Horfield Health Centre. Can I help?
Malaria you contracted where?
I had it twice, at Mozambique and Ghana. Mozambique, I was very ill.
I keep feeling really sick all the time. I have no energy whatsoever, and it's just driving me mad.
I'm going to press in a few different places.
OK.
Yeah. I've been off of work for over a year now because of the had a bleed on the brain.
Yeah.
Which doctor said that to you? Bad doctor.
Bad doctor.
I was worried if I had cancer come back again.
Ho, ho, ho. Merry Christmas. It's a wonderful job that you do.
Thank you.
Is there any chance of me having an emergency appointment because the blasted reindeer stood on my foot and it hurts?
Take you in tonight at 6 o'clock.
6 o'clock. I'll go and do some deliveries and come back. Bye-bye. Bye-bye.
Mr. Robert Tyler, please.
Yep.
I'm Dr. Ahmed. We're just
Hi.
going right to the end.
I think when I came to this clinic, I was assigned to you as my...
That's right. You're
But I did
registered
see
with
someone
me.
else the other day, so...
We tend to follow personal lists. What that means is that tend to see the same person.
Okay.
You can see them, if you can change if you get fed up with them. So that both sides get to know each other.
Yep.
It just makes it a bit easier. What's on your mind today?
Strange issue when I do exercise.
OK.
So if I run, I can jog for about 4 or 5 minutes, and then very quickly, within about 5-10 seconds, I get this feeling of just like I'm going to faint or something. I get dizzy, and it sort of feels like it's here, but not really a breathing thing. I can't work out what it is, and I just stop. I can't force myself to run because obviously your body's trying to say, whoa. So I sort of stop, and if I stop, I just need 30 seconds, and then I can run again for about 3 minutes, and then it comes again. So it's like it builds up. It just...
So you can run for how long?
I did about 2 kilometres. I feel like, my head, like I'm almost going to faint. I just feel lightheaded.
But you don't actually pass out?
No,
I think.
not at all.
And any tightness in your chest or any pain in your jaw or arms or anything? Leg pains or anything? And this has been going on for how long?
Probably 8 months or something.
About 8 months?
Yeah.
OK.
And I've always had very low pulse.
OK.
So sometimes doctors have gone, and I've just gone for medical or something. I work in the mining industry, so I'm always having medicals. And there's sometimes go, wow, do you feel faint, you know, because I'm on 40-something or...
Right.
And I feel absolutely fine.
You feel fine, that's your standard? OK. I might just check you over, is that OK?
Yep.
So let's just put that on here.
Anti-caravagulist, please. Come on in. Hi, nice to meet you.
And you?
So where do you work at the moment, then?
South Mead. I've just come off a night shift.
Oh,
hence
bad.
I'm
Poor
still
you.
in scrubs.
Poor you.
Yeah.
What are you doing at the moment?
Well, cardiology, but I'm only F1, so
Right.
4-month rotations, so it's not specialised or anything.
And how is it going? Are you enjoying it? Is it?
Sometimes. I think overall I'm enjoying it, but it's quite... The on-calls can be quite bad.
Sure. I did
Yeah.
that job many years ago, and it's probably not changed at all in 10 years. But what are we talking about today? What's what do we need to sort out?
Basically, my urine infections. I've had a lot in the last year, and then it was a little while before I had it again. But then last week, or potentially the week before that, I had another urine infection.
Right. So how many had you had beforehand? Was that something that you'd had?
Yeah, so in the last year and a bit, I've had probably 10, 9, something like that.
Yeah,
Not all
so
of
that's
them.
a lot, isn't it?
Yeah.
Sure. So that
Yeah.
was the decision then to start you on the medicine to try and stop them from
Yes.
coming.
And it did seem to work for a bit,
Yeah.
and then...
have you just had one since you've stopped it again?
Yes.
And that was... which month did you stop it?
Maybe March.
OK. So you had a sort of 1 to 2 month window where you didn't get any, and then you've had them again
In the
just
other one,
recently.
yeah.
And I mean, from my point of view, it seems very reasonable if you're getting them roughly 1 per month to take a tablet every day to try and stop that happening.
I'm hoping.
So I'm very happy to get that restarted for you. It's complicated because, of course, we don't want to be creating resistance to bugs.
No, I know.
But on the other hand, if you're taking a lot of antibiotics because you keep getting infections, then you're using quite a lot of antibiotics anyway.
Yeah.
So hopefully, this should mean that we don't need to worry about it in the future. But we'll have to wait and see. So obviously, you can play that one by ear. Good. So those have all gone to the chemist next door. Hope you get some sleep.
Yes. Well, it's the last day, so I'm going to.
Oh yeah, so you're going to try and stay up.
Yeah. I always hate that day.
I know.
OK, cool.
Nice to see you.
Thank you.
Bye.
Bye.
OK, just breathe normally. I'm just going to listen to the heart. That's fine. Pop your things on. Come and take a seat. All sounds all right in there. So I think something's going on that's changed in the last 8 months or so. So we need to look into it and check it out. So the first thing we're going to do is check some blood tests, including checking your cholesterol, your sugar level, your thyroid function. I'd also like to get a baseline ECG or heart recording. It goes without saying at any point if there's shortness of breath or palpitation or chest pain, straight to A&E for a check over. I don't know if your pulse is varying when you're exercising and you're getting some kind of change in rhythm.
Yeah.
We might also have to put a heart monitor on for 24 hours or maybe 7 days, which is a bit of a pain, but, you know...
I had
it's
one once
checked.
after the
low pulse?
malaria.
Oh, after the malaria. Okay.
Yeah, I seem to have some weird issue.
And the malaria was when?
That was a long time ago, like 15 years, 20 years.
15, 20 years.
And then dengue was about a year ago.
So that
and I was quite ill, so I was medevaced from Sri Lanka to Singapore.
OK.
I was quite ill for a day or two, didn't really know what was going on, and they were quite concerned.
And malaria you contracted where?
I had it twice, Mozambique and
Okay.
Ghana. Mozambique, I was very ill as well.
OK.
They thought I actually was going to make it.
Right, OK.
Because I was stuck in a bush camp.
Yeah,
My temperature was at 42.
You've been through a bit, haven't you?
Yeah.
So I'll have a check on those because obviously we don't come across tropical diseases very often to see if there's any long-term sequelae from any of those. But let's do the basics first. We'll check you over and see. So if I give you that, I'll just show
So
you
that's
the
a booking for ECG thing, is it? Oh,
Yes.
yeah, OK.
If you go to main reception, they'll sort you out, and then I'll take it from there.
OK, excellent. Thank you.
I'll be in touch. Take care.
OK, see you.
Thanks.
Thanks.
Bye.
Come and have a seat.
Thank you very much. Thank you.
So I'm Dr. Liz Lee. I don't think we've met before,
No, I
have
don't
we?
think we have. No.
OK.
I had a mental health assessment last week and I had a letter which was about the extra tablet that they suggested.
Yes, Tom Pelly has just written a note, so...
I think it was Miss Dr. Pelly
Have you got it there?
Yes, I have. Yeah, it's the last section.
There we are. So are you happy with this plan? Were you did you share on that meeting?
Yeah. It's just that I have real difficulty going out and like in social places, town and stuff, just because I feel people are laughing at me, and it's got worse.
She's a lady with known kidney cancer with small volume lung metastases, full stop.
Your chap I went to see, he's actually really well. He's a lot better in himself.
Take a charcoal swab, just a swab from your vagina yourself. Do you want to do that?
I have real difficulty going out and like in social places, town and stuff, just because I feel people are laughing at me, and it's got worse. And I had the assessment, and she said it obviously wasn't a magic cure, but hopefully it would help.
Has this been a long time, this problem?
Yeah, I've had it for a long time. I do all the, no, they can't be laughing at me.
Yes.
You know,
Have you done CBT? Have you done some sort of...
I've done DBT.
OK.
But not CBT.
What's DBT?
It's dialectical behavioural therapy, and it's to do with your emotions, kind of challenging some of the things that you think. So say I was feeling that people were laughing at me, it would be like, well, you know, they might be laughing at a joke or laughing at something they've just seen, not necessarily me. But when I'm out, it's really hard to get that in. And also it involves mindfulness as well.
That's great, actually, because I think we all know that feeling of they're talking about me, but actually they're not talking about me at all. I'm nowhere in their thoughts. But what I expect they hope is that this will just calm things down a bit, and the new one that they're going to give, so that then you can use your DBT training more powerfully and begin to sort of actually convince yourself of the truth.
Yeah.
Michelle suffers from social anxiety, and actually this is a really common problem. It's one of the real drivers for the illness agoraphobia, where people just don't want to leave the house at all. We then have to talk about ways of addressing this problem of a false perception, because in fact people aren't talking about Michelle or laughing about her. She just thinks they are. So with DBT, the therapist will work with the patient to try and get them to accept who they are and not constantly be fighting their own personality. And then as a result of that, small changes in behaviour can be encouraged and made, and this makes a great difference to your interaction with the wider world. In fact, you're my second patient today who's got this problem. And what's impressive about both of you is you've managed to come and sit by yourself in the waiting room, which is quite difficult to do, isn't it?
Yeah.
And to come in by yourself. So obviously you're making some progress. Great. So consider adding this other drug called pregabalin. What did you feel about that?
I guess I would be anxious to start it. Yeah.
Right. The talking therapies and medication both work by themselves, but the medication works to settle some of the disabling anxiety, and that allows you to focus more on the quite difficult work that's required if you're going to undertake CBT or DBT. Do you live by yourself?
I do, yeah.
So you haven't got anyone to push you out in the door?
I've got a dog, actually.
Oh, that does work. That's good.
Over the years, I've probably walked a lot more than if I didn't have him.
Yeah. Great, good. Listen, this says for general anxiety disorder, you take 50 milligrams up to 3 times a day. So they also, this warning says that if you're taking anti-epileptic drugs, well, Tegretol you take.
I do, yeah.
Very occasionally, the combination of the 2 drugs can make you feel really bad in the first week.
OK.
So I'm just warning you, if you suddenly feel suicidal thoughts coming up. I mean, do you have those sorts of thoughts anyway?
Not so much as I used to, and I feel pretty certain that I wouldn't act on them because I have my dog.
Good.
I wouldn't leave my dog.
No, you mustn't leave your dog.
No.
Great. Nice to meet you.
Lovely. Thank you very much. Nice to meet you.
And you. Very good. Good luck with it all.
Yeah, thank you.
And you just let us know if you get worse. That's
I will.
All right.
Yeah, thank you very much.
Bye.
Bye-bye.
Hello.
Come on, you gotta go and say hello.
Oh, Mummy. What do you want for Christmas, then? A Jeep. What's a Jeep for Christmas?
Coming in, Santa, my turn? No, I think we'll give it a miss.
I'll brace myself.
You'll have to brace yourself hard.
Bye-bye. See you soon.
Paul Harris? Yes. Yeah, hi. Thanks for waiting. Sorry I'm running a bit late.
OK.
OK. Come and have a seat. Now, what do we need to talk about?
I came in some time, well, a little while back.
Yep.
Right, my shoulder, my arm.
This was in April when you saw Dr. Ramshaw?
Yes.
Yes.
I had X-ray and some ultrasonic sounds on it. A course of tablets and cream. I would say is getting a bit worse than better.
Right, and I haven't read all the notes, sorry, because I was running a bit behind. Do you mind if I just have a look through it and see? So, good news on the ultrasound scan. And the shoulder joint they report as normal as well. So we've done the 2 relevant tests and neither of them have really given us an answer. Can I just examine you now myself?
Yes, that's not a problem, yeah.
So if you just stand up, if I take the weight of this arm now and I try and lift it won't go. No. Okay. Because it's blocked or because it's too painful?
It's too painful.
All right, have a sit back now. So this looks like a condition called frozen shoulder.
Right, OK.
So the 2 things I think that you've not had are a steroid injection into the shoulder, OK, and physiotherapy. Now, the good news is that frozen shoulder does resolve over time. Do you want me to do a steroid injection now, or do you want to think about it? Or?
I'll do anything just to see what, if it fixes it.
Yes. OK. So it's steroid mixed in with local anaesthetic, OK? Usually it's not particularly uncomfortable. Occasionally it is. I'm sorry if that's the case, but usually it isn't too bad. Don't expect that there'll be a miraculous result. I mean, you may find it's more comfortable for several hours because of the local anaesthetic, and then that will wear off, and then you'll be back to normal. There's always a theoretical risk of infection getting into the joint, which is bad news if that happens. The risk of that is about 1 in 2,000, I believe. I've never seen it happen, so I don't think there's any particular reason why it should happen to you, OK? Now, actually, you'll need to take your shirt off, so if you do that. Great. Stand up. So there's a prick coming up now, all right? I'm putting in more local anaesthetic than I would normally use in this situation. I'm just trying to distend things within the joint a little bit. Is that OK?
Yeah.
Not uncomfortable?
That's OK.
All right, yeah. OK, do you want to pop your shirt back on? Just give that arm a little bit of a move around, actually. So if you try and do some of those movements we did before. Yeah, OK. And we'll try and get some physio for you as soon as possible, OK? Any problems after injection, let us know.
Right, thank you very much.
OK, all right.
Thank you.
Cheers.
Thank you.
This is Jim. Jim is our car park attendant.
Car park manager, I like to be known. So basically, we have lots of problems with parents trying to park their cars in here during drop-off and pick-up times. I don't know whether you're one of them. No. So I let you in there.
Jane Byram. Hello.
Hello.
Come on in.
Hello.
So I'm Dr. Lee.
Yes.
And I'm doing a funny thing today. I'm working with our new doctor.
Oh, right.
And I'm seeing the patients and she's putting it on the computer. Is that all right?
Yeah, that's fine.
OK. Come on in. Come and have a seat. So if I could put you there. So this is Dr. Leslie Black, who's just joined us. Right, so what can we do for you?
I keep feeling really sick all the time. I have no energy whatsoever, and it's just driving me mad at the sickness feeling. I have been sick a few times, and if I'm not sick, it tends to just give me a really bad stomachache, and it just feels like everything's stuck and won't digest, and it just wants to come straight back up again. And it's been going on for about 3 weeks now. And we went out for some food last week. I only had a ciabatta and I felt so ill afterwards. So I've just been sticking to sort of squash, water, tea and fruit and salads. I just want a nice roast dinner and not feel sick.
3 weeks is a bit long, isn't it? It's gone on too long now.
Yeah.
So I'm going to get you to lie over here. Let's examine your tummy.
All right,
Have you had blood tests done or anything?
No, not recently.
Okay.
Well, not recently, no.
I'm just going to listen to it for a minute.
OK. Makes me feel really sick when sorry.
Well, it's very overactive. There's a lot of noise in there.
OK.
Let me just take your pulse and things. It's a very nice, steady pulse.
I just feel really...
Yes, I can see you do. You can see it in your face, actually.
I just don't seem to have any stamina. Obviously, I know when you don't eat enough, you can feel a little bit weak and stuff, but...
So we need to do some tests.
OK.
Start with some blood tests. If we do those now, we'll get them back tomorrow, most of them, and then decide when we see what the blood shows, what other tests you should have.
OK.
Leslie, can I ask you to do this? I'm sorry not to show you.
That's fine. Right, let me wash my hands.
So I'm going to do full blood count.
OK.
I'll do a celiac screen while I'm about it. But I want to do a bone profile. Anything else you would suggest?
TFTs?
Oh, yeah, because you're tired as well. I will do a
I'm feeling a bit
hemoglobin.
hot.
Yes, of course. We'll do those things.
OK. I love taking blood, but I don't like blood counting.
I know. Do you know I'm the same?
Very good. I'll ring you tomorrow.
OK.
Is that all right?
Yeah, that's absolutely fine.
OK. Is that all right? That's a bit worrying, don't you think?
It's not quite right, is it?
Not quite right, and she felt very sick when I pressed here. I couldn't feel her mass.
Whereabouts was it?
Just over descending, but not at the bottom. So if she's got anemia, 2-week wait in tomorrow for the endoscopy. We'll do a colonoscopy.
OK.
If she's anemic, we do both actually.
Yeah. OK.
Because I'm worried about her.
Yeah, definitely.
Morning, Bridget. Come on in. How are you?
The knee was 3 times its normal size.
Oh, no.
Through part of last week and right up until Sunday. It's going down a bit now.
Oh, my gosh.
It's so painful. I presume it's arthritis. If you look now, you can see that it's not normal.
No.
And the pain is around there, through the back. I've been rubbing some of the deep heat in to try and see if that helps, but not really.
Have you had it like that before?
Not like that, no.
No. Strange, isn't it? Let me just see who the duty doctor is a minute.
My husband eats a packet of biscuits.
I could
with
quite.
every cup of tea he has.
I could do that. Depends what it is. Give me some custard creams, jammy dodgers, and also ginger biscuits. I love them. I do like my custard creams, I've got to say. I love my custard creams.
Oh, hello. Oh, here he is. Come on in. This is Hello. Hello. This is Bridget Callahan, who I see every week for a leg ulcer.
OK, so your knee swelled up and was painful.
It was literally sort of out here. Couldn't walk properly. And that's when it sort of basically started, Monday night, Tuesday morning. And it was literally round here. And the pain was pulling from here and across underneath there.
OK. The swelling has come down somewhat, but the pain hasn't got any better?
Not really, no.
OK. Have you had problems with the knee before?
Only since the accident.
OK.
And an RTA.
Do you mind if we, while we're talking about it, we get you up on the bed? OK, so you've got naproxen and cocodamol on your prescription on a regular basis?
Yes.
I'm going to press in a few different places.
OK. Yeah. Sorry.
So what I want to be sure is that it's a problem with the knee joint and not a problem with the other structures around it, like the blood vessels or the muscles. I'm fairly confident from examining it that it's a problem with the knee joint.
Right.
We don't want to miss blood clots or those kind of things, or skin infections, and I don't think there's any evidence to suggest one of those things. The knee cap almost seems to be floating, so it's quite bouncy, which suggests there's some fluid underneath it, in and around the joint, which would suggest perhaps a flare-up of arthritis, and it's common to get arthritis in joints where you've had broken bones around it. I guess we need to try and get you a bit more comfortable.
Yeah.
A simple change is go from 3 to 4 times a day for the cocodamol, squeeze in an extra dose, taking it 4 times a day. Having your leg elevated, resting up, making sure your leg is at least as high as your hips, ice it. So anything from the freezer, wrapped in a tea towel so you don't get an ice burn. 15 minutes on there may be quite soothing and bring down some of the inflammation.
All right.
these things tend to flare up and then settle down. If it's not settling down over the course of the next week or so, we need to have another look at it. Yeah, absolutely.
Yeah.
Okay, I'll leave this here and I'll leave you guys to it.
Thank you.
Nice
Thank you
to
very
meet
much.
you.
Thank you very much.
Okay.
Thank
see you
you.
soon. And I'll just scribble on notes.
Oh,
on
thank
there.
you very much. You want to stay there?
All right, I don't
Might as
mind.
well, aren't you? Now you're there.
Yes, it's leaking off.
I can see it's leaking, yeah. Which you don't often leak, do you? So something's going on.
Well, that's looking better, though, isn't it? I think.
It is, isn't it? Yeah.
Yeah.
Have you had clips out before? No. You need to push it in the middle to make it come out, yeah? So I see you're on the new inhalers for this as well, aren't you? And how are you getting on with them?
The yellow one I don't mind, the green one is Frivolta.
Like me, I ran into a brick wall, you know, head on. And I had a stitch.
Were you drunk?
No, I was a little girl.
Oh.
Yeah, because I had a bath this morning to make sure it was clean.
Yeah. Looking pink around the edges, isn't it? I was wondering if I ought to do a swab while you're here.
Is it normal for the sort of purple to keep coming up as it is, or is that just...
The what?
Sort of the coloration.
The coloration. This is circulation, isn't it? Yeah. I'll just take a swab on that as well.
No, it's getting in the stage at night. It gets so hot.
Yeah. We're going to be high enough, is it, Bridget? Or...
I think it probably would, yeah.
Let me help you down, all right?
Yeah.
Oops. Hop along. Let's hope it all settles down now.
Well, hopefully, yeah.
Hopefully, yeah. Open the door for you. Take it steady then.
We'll try.
Try. You haven't got much choice with that knee, have you?
No. All right then.
All right, take care
Thanks,
now.
love.
Bye-bye.
And Whitehead, please.
That's me.
That's you. Hello there.
Yeah.
Come on. Brought reinforcements?
I have, yes. She brought me down.
Shall I take that seat there? Yeah. So your family or friend or sister? Sister. Okay. All right. So we've got some blood results to discuss, haven't we? Can I just go through the background first of all?
Yeah.
You asked Pete in the pharmacy to do your blood test, or he
He offered to do the... He offered, because I was a bit concerned.
Getting very thirsty, was that?
Dry mouth. Very dry mouth. But it's just carried on.
And how long has that been going on for?
It's quite a few weeks now.
And by drinking a lot, give me an idea how much you've been drinking.
Glass after glass.
Glass after glass after glass?
Glass after glass,
Okay.
yes.
And mainly water, or?
No, fizzy, juice.
Okay.
And that.
Something with sugar in or not?
Probably, yes.
So weight, first of all, has that changed in any way?
Has,
In what way has it changed?
I've been off of work for over a year now because of I had bleed on the brain. And my mobility is was severely...
So you put weight on, have you?
And I have put weight on.
OK. Do you think she's changed at all? Lost weight, gained weight?
I would say gain.
Gained some weight. Okay.
Especially.
It's the middle, especially around the middle.
Have you had any thrush recently? So
No.
Dry or sore mouth or white down below?
My mouth seems to feel like it's on fire sometimes, but other than that, no.
Okay. So you wondered if you had diabetes, obviously, from what we
Or
said
just
on the phone.
checking my sugar level, really, that was all.
Pete did a blood test which was
Yes,
high,
well,
the sugar level, and we've done blood tests now, and they point the same way, really. So so yes, I think I have to say you do have diabetes, actually.
Right. Okay. Yeah.
So that's not a complete surprise to you.
It runs in the family.
When you say it's in the family, what do you know about it?
All I know it's raised sugar levels and it needs to be controlled. My father had to inject.
Okay.
My uncle's got it. My grandmother had it as well. Okay. And I know that the consequences is your feet, losing feeling in your feet.
Okay.
And your nerve endings,
that
something like that. Yeah. And your eyesight, is it cataracts? Glaucoma, that's
well, it can cause various things to do with the eye. And glaucoma wouldn't be the commonest, but when you've got type 2 diabetes, which is what I'm sure you've got, there's a problem with the way that the body handles the sugars that have come from your diet. Okay?
I'm feeling a bit more tired.
Yeah, so you can feel tired, you can feel very thirsty, all sorts of things. Yeah. So next thing is we need to look at your diet, okay? And I will get the treatment room nurses to have a look at your diet with you. And we almost certainly are going to need to get you onto some form of medication to lower the blood sugar. So I'll print off some information sheets. I'm going to book an appointment with the nurses. They will give you a long appointment to go through all this with you, and then we'll take it from there. Okay.
Right.
Okay.
Yeah.
All right. Well done.
You cycle a heck of a lot, you know.
Well, compared with most, yes.
I would just pop it over there if I were you. At least then we can try and keep an eye on it for you.
When you say 200 thing...
Kilometres.
Kilometres over what period of time?
That'd be 14 hours. So, if I pass out, you'll have some kind of record.
Racing for an hour.
Oh.
And two of the guys threw up on the finish line.
Oh.
And I gave myself, I pretty much had heat stroke.
James Francie, please. Come on in.
Thank you.
Hi, have a seat. How are you doing?
Yeah, I had ringing in my ears, so I know what's caused it. It was a band practice a few months ago.
Was it? And your hearing hasn't been affected since then?
I haven't really noticed it being affected.
So it's just this ringing. And is it on both sides?
Yeah, I don't know. That's a good question, actually. I haven't really tested to see if it's
But it's not obviously just on one side, for
Yeah.
instance. It seems to be on both sides.
It seems to be.
And you haven't noticed any dizziness or falling over or any other symptom? It's just this annoying ringing?
Yeah.
Can I have a little look in?
Yeah, go for it.
Have you had any thoughts about what's going on or looked it up online?
I looked it online, thought it was tinnitus or something like that.
Yeah.
And, it doesn't really look positive for getting rid of it.
No pain at all? Do you put anything in your ears, like cotton buds or...?
Yeah, cotton buds.
Yeah?
Yeah.
OK. What I can see is that both the eardrums are mildly indrawn, and they should be nice and flat.
Yeah.
And sometimes, if the pressure's not right on the inside, it can suck the eardrum in.
Okay.
And what we want to try and do is get your eardrum nice and flat.
Okay.
Now, whether this is going to change the tinnitus is not clear.
Okay.
Because sometimes tinnitus, unfortunately, is just a condition, as you've looked online, where you get this annoying ringing. So in the first instance, let's try some nose drops of steroid.
Yeah, OK.
And the reason they're good is because they help open up the tube that goes from the back of your throat and nose into the ears, the eustachian tube.
OK.
And you know about when you go on an aeroplane and you pop your ears?
Yeah.
I want you to do that loads.
OK.
Second, these cotton buds can push in the eardrum, and that can be part of it. So try and avoid those. There's no wax at all.
Yeah.
And olive oil probably is a good way of clearing any wax if you've got that. But there's nothing from the outside to see other than the mild indrawing. Okay. It's certainly not bad, but I think this would be a good strategy to try and help everything that we can do.
OK, yeah, sounds good.
The other thing is that with no hearing loss and no dizziness, and it's just on both sides, it probably is just sound-related, tinnitus.
Yeah.
So hopefully we can make some progress with the spray.
Okay.
But if it's not settling down, then the other thing is just to read up about distraction techniques.
Okay.
I don't know if you've read about white noise or putting some earphones on, because sometimes you can just train your brain out of hearing those annoying ringing noises.
Okay.
Cheers then. Hope that does the trick.
I hope so.
Cheers.
My favourites.
Hello, Mr. Scudder.
How the devil are you?
How the devil are you?
Well, now I've seen you two, I'm bloody
Good.
fine.
And now we've seen you, we're fine too. So how many toes we lost this time?
2. So I got 3 left.
We've still got 3 left.
Come on, darling.
Oh, doing it the wrong way. Yeah.
All right.
Right, we have landed. I'm being absconded now.
See you later, my sweetheart.
I know you worry about me.
I do worry, Michael.
Hang on, pull your trouser leg down yet.
Anything for you, my love. He's bloody magic.
Michael Scudder. I've been trying to talk to you for a few days, but Whenever you're in having your dressing, I get called to something else and so on. But I know you're here early in the morning.
I am, my love.
Come and take a seat.
Thank you, love.
I'm a little bit worried about what's going on with you, a little bit, because over the weekend you had this hypoglycemia, or your sugars went a bit low.
Yeah, it went right down, yeah. And lucky I collapsed on a settee, like, you know what I mean? But it's my fault because I wasn't eating.
But why weren't you eating?
I don't know. I just, you know, it was all the worry. I keep going up there and all this nonsense, and, you know, getting on my nerves.
Yeah. Are you vomiting up food?
No.
Because you said to one of my colleagues...
I was just sick. I was just, we still look upset. I was all just getting now and again.
So when you eat your food, it's going down okay?
Yeah.
Okay.
I've lost some weight, mine.
Yeah, you have. Are your bowels working normally?
Yes.
No blood when you go?
No blood at all.
Mm.
And I always I'll check this because it's for a reason, like, you know, when I go to college in July, they say, I said, well, where am I bleeding? I can't understand. I got this camera down there and it's all clear, like, you know.
You've had the bowel check last year, and we don't need to repeat it. But last year you also had the camera test, which showed,
twice.
you know, a stricture. So what happened was that there was a tightening in your food pipe, and then when they repeated it, that had cleared up.
Yeah, that's right.
I'm wondering if that's reoccurred again. How do you feel about if we just repeated the camera test?
I don't really want it.
To double check?
Because I keep going out there all the time and it's doing my head in, like, you know.
I know.
I got this morning.
Because of the foot, haven't you? I know.
It's just doing my head in. Keep going up there all the time, and it's get right on top of me.
Because what I would like to do is, I'm wondering why your blood count has dropped. You see, I don't know if you're losing blood from somewhere. That's the only reason. One thing that would be good is if we could do a wee sample, and
I'll bring it in tomorrow.
That's fine.
Okay.
And we'll probably do a blood test, but not today.
All right,
We'll do it towards the end of the week just to see what's happening.
Okay.
I've also referred you back to the blood specialist, but I don't know if you've had an appointment through.
No, I haven't, no.
Okay.
Well, let's say, I was wondering if I had cancer come back again, like, no, but they would have found that by now, wouldn't they, surely?
Hiya.
Hiya.
Come on in.
Thank you.
So what's been going on?
So Eden has had a bit of a rash for a while, about 8 weeks in total.
Oh, right.
It didn't seem to be bothering her at first, but now it seems to be getting a bit itchy.
Okay.
She's been starting to itch the one on her legs, and then it's been getting a bit more, like,
So it has got a bit worse there, has it?
Yeah. So started off with a patch on this arm,
Yeah.
which has actually improved slightly with the sun, I guess,
Good.
as you'd expect.
Hello.
And that patch was there for a couple of weeks, and then sort of there was a bit more on this arm.
Yeah.
And then it came onto one of her legs.
So she's fine at eating and drinking normally?
Yeah,
and
I mean, she's
Hello.
teething at the moment, so she's had a bit of problem with that, and she had a bit of a snotty nose
Yeah.
last week, but generally she's very
been
well
okay.
in herself.
Can I just take your temperature? Yeah, you're fine, aren't you? Apart from this annoying rash. Well, it's a little tricky to say what's causing it. I expect that this is just a little bit of infantile eczema, and that means dry skin linked to being a baby.
Yeah.
So 2 things I'm going to try, some good moisturiser and just a tiny, tiny dose of steroid to see if that settles it down. Does that sound okay?
Yeah, that sounds perfect.
It's very mild and we shouldn't be needing to use that for very long, sort of up to 5 days maybe. So if there's any ongoing problems, do pop back to see
Lovely, thank you.
Good, hopefully that'll do the trick.
Brilliant, thanks very much. Get you
Great.
sorted.
Nice to see you.
Say bye-bye.
You're out with the door.
Oh, thank you.
Cheers then.
Thanks, bye.
Bye.
What if I wanted to organise a scan whereby you lie in one of those tube things and they do a scan, an X-ray of this bit off you?
Out there?
Yeah. How would you feel about that?
I suppose.
You'd be okay with that, would you? It's not as invasive as having a, you know, because I think I need something to to work out what's going on.
Do that then, my love. There's a party next Tuesday down in Western Supermare. I've been invited down, so I'm going to go down there for a day out. I'm alive. I've just got to get away, like, you know what I mean? I'm gonna
Have a break.
Yeah, I'm going to have a drink.
Not too much.
No, but, well, I'm going to have a drink. And I'm going to take some sandwiches with me. I'm going to spoil myself for that.
All right. Well, I think you do deserve your own treat, but if you're happy for me to scan you...
Yeah, I will do.
I'll do that.
All right, my love.
All right.
Yeah.
Thanks for coming in. I'll come out with you, because I've got to call the next call the next person in.
All right, then scan.
OK.
Yeah. Got to take all my clothes off for that. You know that, don't you?
You just get one of those sexy nighties to wear, though, don't you?
I know. All right, my darling. Yeah,
OK.
I'll ring that now, love. And
All right. We'll see you soon.
right,
I'll speak to you soon.
Open wide. Say ah.
Keep saying ah.
I'm sorry.
I'm so sorry.
Keep saying it. Well done.
Say ah.
Can we have one more go?
And again.
Okay. What's been happening?
So, on Sunday night, I started feeling really unwell, and then started feeling really shivery, and then tonsils, massive.
Okay.
Temperature was like 38.8, 38.9.
Oh, right.
Every time I've had tonsillitis before, I've taken penicillin V.
Okay.
And I had some of that at home, so I did start it, even though I know I really wasn't meant to. But I couldn't come off work, so I had to start it.
Okay, so how many days worth have you had?
I literally just started, like, yesterday.
Right, okay. So no loud singing, shouting?
Not particularly. I am quite a loud person.
This must be killing you then.
I know, yeah.
Have you had any painkillers in the last few hours?
No, actually, I haven't, so hopefully... Like, the pain is definitely not as bad as it was.
Okay.
I work in a hospital, so one of the doctors checked me over on Monday, and he said it looked like viral. He didn't think it was bacterial, but he said there'd be no harm in taking some antibiotics anyway.
Which doctor said that to you?
I know.
Bad doctor?
Bad doctor.
Okay. Deep breath in. They are definitely swollen. They're certainly not full of pus or anything like that. Particularly sore?
They were, but they're much better
Not
today.
too bad, yeah. Okay.
They were massive.
Are your ears okay? Any earache?
Ears are sore, all up my neck is sore.
Have a stand up for me a second.
It's driving me slightly mad.
Any pain here at all?
Not particularly, no.
So your ears are really red.
Okay.
So again, that would fit more with a viral sort of. A little bit red, but your eardrums are nice and clear and shiny. If you started the penicillin, then we probably need to finish that, really, because if it was bacterial, which I'm not convinced that it is, it could just come back and be bigger and stronger and nastier. OK, I need to get this signed by the duty doctor, so if you have a seat in the waiting room, and I'll bring that out to you when it's signed. All right?
Thank you so much.
You're all right. Nice to meet you.
You too.
Good morning, Hawford Health Centre. How can I help?
You haven't told me how much you were drinking. I don't know if you want to.
No, because I'm always embarrassed when you ask me.
OK, well, I won't ask you again.
I was scared. I was scared of going to the gym. Don't know why.
What are you scared about?
I'm fat.
What about smoking? Yes, I do smoke. I mean, smoking does make you much more likely to get this kind of thing, yeah, unfortunately.
I cannot shift this weight. It's like just eat everything in the fridge. I didn't even open the fridge. It's like I shoved the whole fridge in my mouth.
New Year's resolutions can kickstart people in wanting to make some changes with regards to their health.
Perhaps stop smoking, take more exercise, spend more time with their family, do healthy, positive things.
Nicola Davis, please. Hi there, thanks for waiting. Have a seat. Thank you. Right, what can I do for you?
I've been swimming a lot. I started swimming three
Right,
times a week
yeah.
because I want to try and shift this weight. I am really trying hard now. I sort of swim a good mile at least 3 times a week,
Brilliant.
aqua aerobics. I've got exercises from the physio for walking and that, but I cannot shift this weight. I joined Slimming World and I can stick it for a couple of weeks and then it's like just eat everything in the fridge.
What's your real downside, do you think?
Anything sweet, I will just... Oh, yeah. And it's not... I wouldn't think, oh, yeah, I'll have one of those chocolate bars. I'll have the whole packet and not feel bad about it. I actually feel good when I'm eating it, so this is the problem.
What we should all learn when we've got weight issues is about what we're putting in here, really.
I know what I'm putting in is wrong.
Yeah, it's about a healthy eating plan. It's not about, oh, you can't have that. It's about, right, let's pick things that you really like and eat them well, and then things that
It is good. I mean, I've done it before and
Yeah.
it's really worked for me, but just this time it's like...
It can work again.
Yeah, OK.
Is there any way the Slimming World people can help you when those attacking the fridge moments come?
I didn't even open the fridge. It's like I shoved the whole fridge in my mouth.
Yeah.
And it's almost like I need it. It's not, oh, I really fancy that. I need to eat it.
Right.
And I'm really, really struggling.
I think you're doing everything you can.
I'm trying everything and I'm really exercising, but it's just going on.
So
I've never
exercise
been
by
this big.
itself won't do it. That's what they've guidance has said lately.
Yeah. I'm going back again tonight with my daughter because I was going and then I stopped. I thought I'm just wasting my time.
But it is good going and staying. Do you stay at the group?
Well, my daughter wants to tonight. She's put on a few pounds, so she wants to go and she'll be, I'll stay with you.
Everybody in these groups are in the same boat, aren't they? And if they're still losing weight, they might have ideas and techniques of what they've done to overcome it.
OK.
Yeah?
All right.
All
OK,
right.
then. All right,
No
lovely.
problem. Bye-bye.
Thank you.
Hi there, come and have a seat. Hello, hello, hello.
Hi.
So, Jessica, I'm Dr. Lee. Now, what's the problem?
Hi, Dr. Lee.
Hello.
In school, I could feel this part of my nose really hurting when I touched it. So when I went home, I put something cold on it.
Mm.
And then today, after school, I told my dad to look at it because it hadn't stopped, and he said it was
swollen inside, like something.
Swollen inside. OK. Listen, I'm going to look up your nose. How about that? Now, is it going to hurt if I put this in here, do you think?
If you press it, that's when it hurts.
OK, so I'll go very gently. Is that all right?
What do you see?
Nothing yet. Is that the bit that hurts?
Yeah. Ow.
Oh.
Ow.
Just wrong leg.
OK. Well, that was a bit painful, huh? Have you or anyone in your family got sores on your mouth called cold sores? Do you have cold sores in the family?
I have.
Yeah. So occasionally you can get a cold sore up the nose, and it is really painful. Now, that's not a dangerous thing, but what usually happens is it's sore for quite a few days, maybe a week. And then after that, you can get crusting in there that lasts for another 2 weeks, so maybe 3 weeks altogether. I can give you some cream to put in there. Now, listen, put a little bit on the end of your finger and just put it up your nose and rub it round that sore area 5 times a day. And you can do it maybe for 5 days. If it's this, I'm afraid it's still going to be crusty and sore for 3 weeks. We'll see you later in the week. It's a pleasure. Thank you. I'm sorry your dad did that to your nose. I'm very sore.
Thank you.
Bye.
OK, bye-bye.
What do we need to discuss?
I think my ulcer's playing up again.
Just point to where the discomfort is.
It is, like, on my right-hand side, and every time I move, it just feels as if someone's giving me a right wallop in my right-hand side, right on me, like, my kidney side. But I have been under a lot of stress lately.
Was there anything obvious that caused it to come on, other than perhaps the stress?
My partner probably said I was drinking too much.
So, to be clear, was it after you started drinking that this discomfort came on?
Yeah, it came on, like, Sunday. Then Monday I was in discomfort, and then I made a decision not to go work on the Tuesday, and I haven't been in since.
OK. And what have your bowels been like?
Probably gone more than what I usually have gone.
Loose stools?
Yes.
Stools? Loose stools?
Yeah.
OK. Any blood in the motions or anything like tar in the motions?
No.
And any urinary symptoms at all? Because, as you say, this is a little bit in the kidney area. Have you noticed anything with your urine?
Just going rather a lot.
All right. Should we have a feel of the tongue first?
Yeah.
Yeah, OK. Hop up on the couch.
Yeah.
If you can lie up here. OK, nice half down flat.
See, that hurts doing that, look.
Does it really? Yeah.
Yeah.
So this is where you said you were feeling the pain?
Yeah.
That's sore. We come down here. You're gripping your teeth there, aren't you?
That was hurting there.
Yeah.
Yeah.
What about if I press in here?
That's it.
Interesting.
I'm not eating, but then I'm putting on weight.
With all due respect, if you're really not eating, you're not very likely to be putting on weight.
I bet my BMI is 26.
27.
Oh, no!
You're coming out at a high body mass index, which would indicate that you're overweight, potentially obese.
I was eating everything that I could see.
Yeah.
I'm 64 years old and I look like Mr. Blobby.
Have you joined Slimming World?
I put weight on.
Did you?
So I stopped going.
How long did you try it for?
3 weeks.
My wife's trying to lose weight.
Right.
And she's always going to give you these fancy foods like couscous and all that.
80% of weight loss is eating less.
It's like, can't I just take a pill? That'd be so much easier.
Come on in, come and take a seat. Yeah, it's not too bad, thanks. How are you? How can I help?
What it is, the bottom of my foot, the heel bit there, is swollen really bad, and I can't walk properly on it.
OK. And whereabouts does it hurt? In the heel?
Like, all in there, up there.
OK. When you wake up in the morning, is the pain OK? No.
It is, well, it's the time it hurts is when I go to sleep, because you're asleep, you don't feel it. And when you wake up, sometimes I'm thinking, cool.
OK, so let's have a look. What might be easier is if you come and have a lie down up here, pop socks and shoes off and just come and have a lie down there.
Salty smell, cool. Some part reason why...
Don't worry about that.
I did have a wash, but some part reason my feet keeps on smelling all the time.
That's all right, don't you worry. Got interesting legs, anyway.
Eh?
Interesting legs.
Oh.
So it's the right foot.
Yep.
Do you get pain in here?
Yeah.
It's just in there. So in that point there, when you put pressure on that area, does it hurt when you walk around?
Yeah.
OK. And if I press there, you've got the pain. Sorry. But in the back here...
Sometimes the pain does come up and
it comes up
onto it
there.
as well.
Yeah. Come and take a seat. So 2 things. One is, it sounds a bit like what we call plantar fasciitis.
OK.
OK? Underneath the skin, you've got a kind of fascia, or this kind of membrane type thing, and it can get inflamed. And it feels like someone stuck a pin in your heel. There's certain ways to just help it along. And actually, your feet could do with a little bit of support in the arches because they're slightly flat. Swimming might help. Losing a bit of weight might help.
I was just about to say that.
Yeah. We are doing, in the treatment room...
I'm scared. I'm scared of going to the gym. Don't know why.
What are you scared about?
So fat.
But if you went along to the gym, they can show you exercises that suit you. Because there's people of all shapes and sizes going.
I can't put... Oh, yeah.
Not be worried, because you're only 29, aren't you? So
I don't know why I should not be scared really, but I am.
Yeah, no.
That's what my friend goes. He said, "Mate, there's a bloke that's like 34 stone."
It's quite good to go with a buddy if you've got a friend that wants to do it with you. So go along, give it a go.
Okay.
All right.
Brilliant. Thank you.
You're welcome. Take
Cheers.
care. Bye.
Bye.
I mean, I think there are several possibilities here, actually. Could this be to do with duodenal ulcer? Yes, it could. But the duodenal ulcer doesn't really explain the flank pain particularly.
Right.
We also worry about inflammation of the pancreas, which is, can certainly happen after heavy drinking.
OK.
OK. You haven't told me how much you're drinking. I don't know if you want to.
No, because I'm always embarrassed when you ask me.
OK, well, I won't ask you again. It's important to be honest with your doctor about how much you're drinking. After all, we are here to help you, but we can only do that if we know what the main issues are. Many people do drink more than is medically sensible, particularly over the festive period. So the new year provides a good opportunity for making changes for the better. So that could be a factor.
OK.
OK, so pancreas could be a factor.
OK.
So we look for that with a blood test. I'd like to get a urine sample done off you now, I think.
OK.
And then we'll have another chat on the phone this afternoon once we've got results back.
That sounds fine.
Do you think you can go do the pee sample for me now?
I could try.
Go and have a try. OK, there we go. You know there's a loo at the end of the corridor?
I do.
OK. So if you just go up to the end there and then back to room 2.
OK. OK.
Mary Penny. Hi there, come on through.
Hiya. Hiya. Thanks for seeing me.
That's quite all right. How can I help today?
This has been on my ear since February, and now it's started to erupt. It's opened, and I'm not sure what it is. And it's not going away.
How does it feel?
It's quite sore when I lie on it at night, so I don't. It has a sort of burning feel to it, but then that could be because I've now just been touching it.
Any history of skin problems at all?
No, not really. I mean, you know, obviously at my age, all sorts of weird lumps and bumps form, and then they go.
Yeah.
But it's because this is persistent and it's in a sun-exposed area. I just sort of might just let someone look at it.
Yeah, no, absolutely.
It sometimes sort of prickles a bit, almost as though there's a sort of cactus spine in it. It's just a prickle.
It almost has a shiny quality to it, doesn't it?
I don't know, it's quite hard to see.
Yeah, I suppose it's a difficult area for you to see.
Yeah.
OK. Well, it certainly is a sun-exposed area, and I think we take persistent growth like this quite seriously.
OK.
What it looks most like to me is something called a BCC, which is it is a type of skin cancer, but actually, if you're going to get something cancerous, it's probably
on the good list.
On the good side, in that it's slow-growing, never invades other areas, so doesn't spread anywhere.
Yeah.
And so it's something we deal with kind of on a much more routine basis.
Is it treatable?
It's something we would remove.
OK.
If it continues to grow, it can disrupt local structures like the cartilage, etc., in your ears, and become increasingly difficult to cut out. Does that is there any questions that come from that or any worries?
No. I mean, it was just a case of I wanted to come in and find out what it was, because better the devil you know, really.
Yeah. People can sometimes put off coming to see their doctor about lumps or bumps. If you're worried about a lump, particularly if it's growing or changing, I would encourage you to come and see your GP about it. So, what happens next? It is important that you see a specialist. I think that's the first thing to say about definitive treatment, and I suspect that will be cut it out.
OK.
So I'll send a referral letter off.
No, that's great. I'll let you get on with your list. Thanks very much for seeing me as well.
No problem.
So was it painful when you peed then?
No, it's not painful.
I think it's going to be normal. I'll just let that cook for a minute. I'd like to take a blood sample. Can you do that now? Yeah. Well, actually, this is interesting. There is just a tiny trace of blood in the urine. Now, some people do get that for no bad reason.
OK.
But if we don't find anything on the blood tests, maybe we should think about investigating your kidney, which...
OK.
OK. Most important thing is to check for the pancreas problem we talked about.
Okay.
Also check your kidney and liver tests, and I'm checking your blood count as well in case there's any clues on all of that. All right. Great. OK, so that will be back by mid-afternoon. OK, all right, we'll speak later.
OK, thank you,
all right,
Dr. Hill. See you again. Bye. All right, cheers.
I've got an appointment at 9:40 today with Dr. Pele.
It's 10:40.
Can I rebook that appointment with him?
Can't wait for it, no.
Well, not an hour.
What are you looking for?
It's all right, there's a little problem. I've got it wrong again. It's 10:40. I mean, I'm happy to do 10:40. It just means I've wasted my wife's trip down here and I can come back.
Look, I'm getting rid of him for a day soon.
Yeah.
He's going to his sister.
If he would like to see me at 10:40, I don't believe...
That'll be fine.
Very
All right.
much.
OK, thank you.
So I noticed that last time you came in, you saw Dr. McLaren, and he said he wanted you to have a chest X-ray. Did you ever go for the chest X-ray?
No, I didn't. I was so busy in work, I don't think I did.
So we need to get that chest X-ray, and because you've smoked for a long time, you could potentially have something called COPD, chronic obstructive pulmonary disease, and it's basically where there's damage to your airways, and that can sometimes mean that you get more chest infections regularly.
Oh, I see.
Right, if we can have a listen to your chest. If you pop your jacket off
Of
and
course.
your jumper as well. Right, nice deep breaths for me. And out. OK. So your chest sounds reasonably clear. There's definitely not any wheeze there.
That's good. That's good news.
You've got a few fine crackles, a little bit lower down on both sides, but nothing severe. Have a lean forwards for me. I'm just going to tap on your back.
OK. You know, I tried to give up smoking last week, and I carried on for 3 days.
OK.
And when I give up smoking, I become a very quick lose temper. You do not believe. I'm like a Spanish bull, having head down, going... I said to my wife, I'm going back. She said, I know, go back. You did before. You tried to give up before, I know.
So do you want to give up smoking?
I do.
We have specialist nurses that can help you to give up smoking, and all the evidence shows that if you have the help of somebody else, it's a lot more likely to be successful, and that
I think
will
that's the best,
help.
yes.
With regards to your breathing now, I don't think you need any antibiotics, but we need to get you to have this chest X-ray. So I will book you on for the chest X-ray.
Lovely. Thank you for your help.
You're welcome.
Thank you.
Take care. Bye.
Thank you. Bye-bye.
That's yes.
Hiya.
Come and have a seat. OK. So we're having a look at your legs, aren't we, to see what's... So we did a scan to exclude a DVT.
Yeah, but no, I got no pain at all with it, or aching, or burning, or... I went round the garden centres that Saturday, so a lot of traipsing around, and Sunday they seem to have gone
better.
down.
Interesting. Gravity will take fluid down to your feet and into your legs, and activity will bring it back up. I just want to check your blood results, because sometimes, you know, things within that can explain the swelling. So your albumin level, that was the thing I was interested in, and it's a tiny bit low, so it's a sort of protein in the body, and if that drops a little bit, you can get a bit of swelling. It's just under the normal range, so that might account for this swelling in your leg. But as I say, my main concern was if you're getting a blood clot, because with a cancer you're more at risk of blood clots. So having excluded that, I kind of, you know, then I'm not interested anymore. That's not true. Bradley has prostate cancer, which has spread to the bones. It had spread in this manner when it was diagnosed back in 2012. He's been receiving regular treatment from oncology during the past 5 years to prevent further spread of the cancer.
It was just the other night I had a terrible episode where I was so ill, just felt so incredibly ill. But a couple of hours later, I was, you know, all right. Didn't feel sick, Didn't have any aches, but just ill. Yeah.
And you're actively having treatment as well at the moment, aren't you?
Yeah,
having the radium...
223,
Yes. Is your treatment once a week?
No, once a month.
Once a month, right,
Yeah.
OK, so yeah.
So, but they're very good down there. You know, I can't, praise, like, oncology and, well, all you guys are enough. Like, everybody's been fantastic. Unfortunately...
It's been a bit relentless, hasn't it?
Yeah.
It's one lot of treatment.
Well, I think Pam was a bit down the other day because it's hospital appointments and, she said, it'd be nice just to have a day off from all this, My main concern is, like, when I lose control of everything, I've accepted, I'm OK with it, I know what's going to happen, but...
Yes.
Initially, I said, I'll just stay home and die at home. But then seeing how much work was involved with that, so I said, well, now I'll go into a hospice. And then the more you think about it, I probably won't get a choice, I know when I go out that door, I'm not going back.
Yes.
That's the end of the story. But then being carted off somewhere... strange, and I think I just want to go to sleep, feel a bit rough one night, go to sleep and not wake up.
Yes.
What do you think all this might be?
I'm thinking it might just be stress.
OK.
I just thought it's due to stress, and it's just stress and stress.
Have you had any particularly stressful events or anything like that? Or...
I got quite panicky today. I was just sitting there and all of a sudden I'm like, I can't think of how to breathe right now. What's going on?
Are you stressed at work?
Life is stress, but yeah.
Do you suffer with mood issues or anxiety at all?
Stress is something that's always been part of my life. I just feel like from one minute to the other, I start shaking. I feel like I'm gonna collapse on the street.
I had a period of a lot of stress, so I started doing yoga, and I am feeling loads better.
Oh, that's brilliant. So you're actually sorting out your physical, mental and spiritual health, or, all of it.
They were saying it may be a bit of stress.
I know stress is a horrible thing, but it happens to all of us.
Yeah.
So, how are things going since we last met up?
Well, I've been doing a headache diary.
Have you noticed anything interesting or enlightening?
Well, mornings it's generally either no headache or like a 2 or something like that, and then it just gradually builds up.
Yeah.
Went to the optometrist.
Yeah.
They said it's got nothing to do with your eyes.
Yeah. Are you still getting headaches all the time?
In the last couple of days, I've been waking up with no headache, which is something different.
Right.
I think this could all just be down to just work.
So, OK, what can you do to counter that, then, or balance that out?
One thing I can do is probably take a few more breaks at work, that's for sure. I tend to, a 13-hour day without even quibbling about it and just crack on,
What I see both professionally and personally, with friends and family as well as at work, is that I think people keep going, and then sometimes if you don't do anything, something gives, and you can get something quite serious, I think stress is implicated in a lot of illnesses, and quite serious illnesses, more physical problems as well. So I think it's really important to take note of it. Sometimes we get to a point when it's getting a bit too much, and I do think often that's when our bodies will tell us something, and say, well, hang on a minute, maybe you need to stop and redress it and look at it. We know that stress is a big factor in many illnesses, both physical and mental. And we also know that many people are overworking, working harder than they want to, finding it difficult to switch off, and they haven't achieved a good work-life balance. In addition to that, we recognise that at Christmas there are a lot of additional stresses. For example, often being very busy and sociable, spending money that perhaps we don't have. So we recognise it's important after the Christmas and New Year period for us to rest, relax and recoup and perhaps reflect on where we're at and what's a good way to move forward. I appreciate often professionally it's difficult to change things, but I mean, do you think there are things you can change?
I've been having a chat with the bosses, and they're also quite concerned about the whole situation. Got another person on board. We're trying to there's a lot of active stuff that we're doing at work.
And do you think that's going to work?
I think so.
I'm going to book you in to see me in a fortnight.
Yep.
Because I want to see how you're doing from the point of view of the headaches. All right.
Thank you very much.
Thanks, Will. Nice to see you again. Cheers. Bye now.
See you later.
Good luck with it all.
It's hard, isn't it? Because you're kind of... You need to be planning in your head...
Yeah.
...that the end is coming one day.
Yeah.
But actually, I want you to be living for the moment as well and enjoying what you have left.
I don't sort of dwell on it. I'm not depressed or anything. Sometimes I'll just sit down and write a letter to Pam or to the grandkids, because that was another thing that sort of scared me, was being so drugged up towards the end. You know, I might not even recognise anybody. You know?
I think we never know. We just don't know what position people are in.
Writing things I want to say.
Yes.
Sometimes when Pam reads them, it upsets her. Then she's all right with it.
Yes.
Yeah, yeah.
For patients with cancer, our role is very important. We know the patient, we know their family, and we are often at the centre of the decisions around care. We prescribe with the assistance of the palliative care team, but we're also just there to offer support and talk through any concerns. Some people don't want to talk about the fact that they're dying. Bradley is able to talk about it, and he remains positive, pragmatic and realistic about the future. Have you got a will?
Yeah,
Yeah.
that's all that. But
Yeah.
most, funerals paid for and all stuff like that. You know. All in all, I'm pretty good. I'm, keeping, well, I was going to say well. I'm keeping all right, Right.
Excellent.
Well, nice to see you.
Nice to see you too, and I will see you when you need me. Yeah.
Yeah, any problems, I'll
You
give
know
you
where
a
to
bell.
find me. Yeah.
All right, thank you very much. Oh.
Okay, see you again.
All right, lovely. Thank
Bye-bye.
you, Dr. Bye-bye.
Proceed. How can I help? I started to have a bit of a pain in my stomach and a bit of a cough, and I thought it might have been something I'd ate or something. It's kind of been rumbling over the weekend, but it's kind of changed. I've still got this cough, but now I'm getting this pain sort of up here, which radiates like my back. Okay. And how long does it last? Well, a severe one's probably about 10 seconds, but this morning it was really bad, and it was happening like every 30 seconds. I'd have this weird wave. And you eating okay? Yeah, eating fine, no sort of loss of appetite or anything like that. Right, let's check you over and see. Thank you. Yep, it's completely fine. Be easier if you came over here. Yeah. You okay lying down? Yeah, of course. So I'm going to feel all over. Yeah, that's fine. And you tell me if I get the place where it hurts. It's definitely not more right or left. No. No. Yeah, that's just there. There? Yeah. Definitely there, right. I want you to take a really deep breath. I'm just checking your gallbladder. And then breathe out. A bit. That's a bit. Yeah, just a bit there. And there. There, definitely. Yeah. Come and sit down. Right. Your chest, your lungs and your heart all sound fine. Your blood pressure and temperature are fine. Yeah. I think what it is, you're really tender around the top bound of your stomach. Yeah. And I think that's probably what's happened, is you've probably got a bit of inflammation inside your stomach. Okay. And that's what's causing you all these sudden pains. I think you've got a bit of gastritis. Okay. Have you taken anything for it at all? I've only been taking sort of Alka-Seltzer, paracetamol, just because that settles my stomach. That's a good idea. I think what we should do is give you something a bit stronger, something called omeprazole, which is a tablet to take 1 a day for a month, and normally that gets it better pretty quickly. Yeah. The other thing is to alter your diet a little bit. The sort of thing that makes this bad is things like curry, spicy food, very acidic food, and alcohol. Yeah. What about smoking? Yes, I do smoke. Okay. A lot? Or a no, not really. Probably about 10 to 15 a day. Yeah, I mean, smoking does make you much, much more likely to get this kind of thing, yeah, unfortunately. Have you thought about trying to stop? I have tried to give up before. Yes. It's just proven difficult, and I've had a vape, and I've tried the patches, but I had a reaction to the patches, so I couldn't try that. The chewing gum was quite good. I mean, a lot of people have to try quite a lot of times before they get there in the end. Yeah. But it doesn't mean to stop trying. Yeah. Right, so I've sent that to the chemist. That's great. Thanks very much for that. Bye-bye. Bye.
Okay, come and Grab a seat.
Thank you very
yeah,
much.
hello there. Your mum, aren't you? Yeah. Drag up.
Thank you.
OK. OK, what do we need to talk about?
Oh, God, everything.
What's the most important things we need to talk about?
I've been trying to lose weight, and I've got, like, ME and stuff, so it's obviously difficult. I've been sticking to, like, 1,200 calories a day.
OK, well done.
And I've also, like, had to go to physio for my shoulder, and there was, like, exercises they gave me to do, which are, like, daily. So I've been doing them, and I've managed to up it a bit and sort of add in, like, a sit-up here and there and some squats, and but I'm just gaining and gaining weight.
She's just very hard on herself. She works extremely hard and she exercises every day. And before, if I said this time last year, she'd have lost the weight a couple of weeks down to her, not skinny, because you're not a skinny person, but she'd be fit and she'd feel quite able. But she's doing the same things, if not more, and she's not losing anything. And also her moods are awful.
That's
to the point that it's like, I'll move out. I'll live with the cat in the little shack at the end of the garden. Because it's like, it's really like walking on eggshells, seriously. It's like...
What did you think of that, what Mum just said?
It's fair. I suffer from depression, and as soon as it's like moods, it's like, depression will get you back on the tablets. And I don't feel that I'm anywhere near that headspace that I get into when I'm depressed. Like, I don't feel... I'm not crying at Co-op adverts, that's always the signs. But I am definitely like, I'll sit there and then Mum will say something, I'm like, like hulking out. And there's no need for me to get angry. But I don't think it's depression.
No, I mean, I must say, I don't get the impression that you're depressed from the way you're talking and from the things that you're saying, actually. So you may sometimes be irritable, but that's not quite the same thing.
Yeah. But I think the weight at the minute is your biggest issue.
You told me that you're being careful with what you eat, you're keeping to a low-calorie diet.
Yeah.
And you've talked about your weight going on.
I was 13 stone last week, and I'm up to 13.5 when I weighed myself yesterday.
In just under a year, you've gone from 78 to 85.
Yeah, it has sort of...
Which obviously is a significant weight gain. I mean, a couple of things. One is if you can learn to eat slower. A lot of us are wolfers, aren't we?
Yeah,
you know,
I definitely think I'm a wolfer.
You've put in too much before your brain says, hey, I'm full. Make sure you put your hands down between each mouthful. So you take a mouthful, put your knife and fork down, sit on your hand.
OK.
You finished it. Then take the next mouthful.
Yeah. You're so going to have to get on me about doing that.
OK, well, but everyone can do it, can't they? That's a top tip. Another top tip, which I expect you've done already, is to use a smaller plate.
Yeah.
Use a side plate instead of a large plate, and don't come back for seconds.
Once I leave that kitchen, I'm out. No going back. Yep.
So is that helpful?
Yeah. Cool.
OK.
I will start doing that. Thank you very much.
Yeah, let's do it. OK.
Oh.
Cheerio then. Okay.
Thank you.
Bye-bye.
Bye.
How can I help?
My wife's nagging me about a possible vasectomy.
So what's made you think that would be the right thing to do?
I don't want any more children.
Right.
I'm married. I've got 2 children, 2 little boys. Financially, physically, and my wife as well.
That's enough.
We always said we'd have 2.
Yeah.
People question because we've got 2 boys. You know, you might want to go. I was like, well, yeah, I'm all right.
Yeah, fine. And at the moment, what contraception are you using as a couple?
She's having trouble with the pill that she's on, making her quite ill, so we're using condoms and stuff as well.
OK.
And she's going to have an injection, I think, in the next couple of weeks, I think,
OK, fine. So the situation, interestingly, has changed a bit about referring for a vasectomy now.
OK.
So in the past, until very recently, I would have just referred you for a vasectomy because you want one.
Yep.
But it's changed now that we now need to have tried other methods of contraception, mainly that the women use, obviously, because there are no other methods for men apart from condoms. And they have to have been unsuitable before we are allowed to refer you for a vasectomy.
Right. OK.
And the reason for that is quite sensible, actually. When a woman is using contraception, she also gets some non-contraceptive benefits.
Right.
Like periods can go on the injection, so that's quite nice.
OK.
Or can become less heavy if you're have a particular sort of coil. Or the pill.
Yeah, because the pill she's on at the moment, she has quite, like, every couple of weeks, and she's having quite a lot of pain.
So that's
with it,
really
which
not
is why...
working for her.
No, and it's not for a while now, I don't think, not probably since.
So I think it's a really good idea for her to try the injection. And if that works for her as a method of contraception, then what has been decided in this local area is that that will be the method of contraception rather than you have a vasectomy. And the other good reason for that is that having a vasectomy is actually an operation and has some small risks associated with it. And so that are more than your partner having the depot injection, OK?
OK.
So what I suggest is that she has a go at seeing how the injection goes.
Yeah.
If she's unhappy with that as a method of contraception, then she should come back and see her own doctor and talk through other options. And then once all the options are tried for the woman, if they fail, then we can refer you for vasectomy. So we have tried to refer a few people who haven't tried the depot injection and haven't tried a coil, and it's been rejected.
Right, OK.
OK?
All
right,
thank you very much.
That's OK.
Thank you.
Bye now.
Goodbye.
Barry Thomas, please. Have a seat.
Thank you.
Right, what can I do for you?
What it is, first of all, I need, I got fluid on my leg.
So when you say you've got fluid on your leg, what do you mean exactly?
Well, it's like... See?
Right, OK. So I think what we need to think about is why, if they're a bit swollen.
Well, I think it's the, Sorry, I'm out of breath.
Yeah, so take your time.
Yeah.
Catch your breath a second.
Right. I think it's the blood pressure tablets normally do it.
OK. Catch your breath.
Yeah. Because I'm on that.
OK,
yeah,
calm down.
All right, OK.
I'll have a look at your medication.
Yeah, yeah.
And you take a break.
Do you smoke at all?
I do, yeah.
How many a day?
Probably about 15.
How many years have you smoked?
Since I was 17.
So about 40 years.
You're not a smoker?
I'm a smoker.
You are a smoker?
Any plans of stopping?
I have tried to stop. I tried to vape. I just can't get on with it. I really can't.
Have you got any thoughts about trying to stop
I do want to quit, yeah. Just not going to well part at the moment.
I tried the patches a few years ago and put it on my arm, and it just burnt on my arm and like near enough blistered out. So I was like, oh, let's go in.
I'm not ready to give up, really.
Why is that? What do you think would need to change for you?
I don't know. I just enjoy it.
And the chewing gum tastes horrible, and the thing you suck on tastes horrible. And
Come and see someone in the treatment room.
I'll try.
Because they do some magic in there.
You are smoking, aren't you? Which obviously it would be good to cut back on the smoking. I don't know how you feel about that.
No.
So you've got diabetes, you've got COPD.
Yeah.
Blood pressure.
Yeah.
And was it a heart attack you had in September 2015?
Yeah.
Yeah, OK. And then I'll have a look at your blood pressure. You're on a bit of a cocktail. Right, you've got your breath now.
Yeah, yeah.
OK.
Yeah.
So tell me how long this has been a problem.
Weeks now, probably weeks. If I try to do any walking, right, OK?
Yeah.
Then it swells, swells up
OK.
again.
And is it both legs?
I don't know, no, this one ain't so bad, because I got chicken legs anyway, but, you know what I mean? Sorry.
It's all right. OK. So what about your breathing?
Yeah, my breathing's pretty been... Because the thing is, see, I stopped smoking, right?
Well done.
But I start again, right? I can go 3-4 days cold turkey, not worry about it.
Yeah.
And then, for some reason, my breathing gets better, right? And I'll smoke again, but I'm still battling it, right? Do you know what I mean?
Keep battling it.
Yeah. Oh, yeah, I got to, because I feel so much better when I stop smoking.
Because when people first stop smoking, the tiny little hairs in the airways that have deadened with the cigarettes start to come alive again. And they work and start to bring the muck up again.
Right.
All right? So it can get worse before it gets better. Are you coughing anything up?
Yeah, sort of greeny phlegmish.
Any chest pain?
A little bit of discomfort, I guess. Most of the time is when I smoke.
When you smoke?
When I smoke. If I don't smoke,
I
don't get I get no pain. Right. I don't stress about it. I don't start thinking about dying and all this stuff.
Okay.
I'm like, you know what I mean? It's like.
Right. Let's have a little look at you. Let's check your blood pressure. So to stop the cigarettes, have you seen our nurses for help?
No. Every time it's like weeks away, isn't it? And every time.
Yeah. But the thing is.
Every time I go there, every time. I got to see her, I've already stopped.
Yeah, but the thing
and
is,
then I don't,
if you do it with their help, you're more likely to stay off the cigarettes.
Yeah.
All right?
You're right there, I know that.
So keep your arms straight.
Right.
OK, bit high. OK, let me have a little listen to your heart and your chest, OK? Can I pull this up?
Yeah, of course.
Deep breaths. And out. OK. So look at these legs. Right, if you pull your trousers up. Right, OK. I'm going to give you some antibiotics because you're coughing up green muck. You're a bit breathless, all right?
Yeah.
I think that's related to the smoking, OK? But I think we need...
both know that,
But I think we need a bit of an MOT. I think what could be happening, your heart could be struggling a bit to pump all the fluid around, and that's why it's accumulating on the legs, all right?
Okay,
So I think we need an ECG, bloods and a chest X-ray to help us work out if there's some signs of heart failure.
I thought you was going to call it ambulance. I thought it was like thinking, oh, my God.
You're not that bad yet, but let's get things better.
All right, cool.
All right?
All right, thank you.
No problem. Nice to see you.
And you.
Bye-bye.
Thank you.
How are things? What are we talking about today?
Good things and new things.
Good.
Good things is that I've been able to dramatically change my situation at home, finally.
Excellent. Much better for you.
And then I've started to make goals that are achievable in the short, middle, and long term, which is really good. Actually,
That's
I don't think I've ever done that in my whole life. The first one, the now was the house, obviously, to make
Sort
my
all of
environment
that out.
livable again. And the middle term is I've had this idea in my head for many years of making a drumming ensemble of many different drumming culture, like a world music, all in one
Sounds
place.
fantastic. Yeah.
So that's going to happen, which is amazing. And in the long term, I've already asked for a couple of prospectuses from the Open University because I need some intellectual stimulation so badly.
That's brilliant, George.
Thank you.
And I wish...
I'll take it as a compliment because it's really been difficult to get to this place.
You said to me last time that you're not going to take the antidepressants and we're going to look into how to manage things. So you've done that for yourself.
Yeah, definitely.
Found out what your needs are and go forward.
And I feel really good, especially mentally. I'm in a really good mental space where I've been eating fish every day, and it's kind of given me some clarity, I think, some sharpness or something.
Your blood tests, kidney function, blood count, liver function, lipids that they did at the Brecon unit are all fine. So a lot of symptoms have settled down that we talked about last time. We've come a long way and it's fantastic to see that. So I'll leave that up to you as to when we touch base.
Okay.
So that's a list of things that we've talked about today. But I'm really happy with your short, medium and long-term goals.
Me too.
That's brilliant.
Me too.
Good. Nice to see you, George.
Likewise.
Good. Take care.
Okay, bye-bye.
Bye, George.
Thank you. All right, bye now.
Thank you very much for your time.
Okay, no worries. My New Year's resolution is to address my work-life balance. I'd really like to finish work in time to get home for my son's bedtime.
I've always thought about joining an amateur dramatics society, and next year may be the year that I do that.
Thank you so much.
No problem. OK, all the best.
My plan for 2018 is to run London Marathon.
That's lovely, Doctor. Super. Thank you very much indeed. Appreciate your time.
In 2018, I plan to spend less time online and more time with my family and doing things outdoors.
Health Centre, can I help?
And I was leaning on my goalpost and I said to my dad that I feel dizzy. And the last thing I remember him saying to me was, sit down, just collapse.
In prison, you were essentially bullied. So what's that from?
Burns.
Really?
Yeah.
With cigarette butts?
Yeah.
He's really crying in pain, and he just can't open it, and he's rubbing it.
Can you see through that eye?
I've had 3 burst eardrums in 2 weeks.
I was in chronic pain. I mean, it was definitely at least a 9 out of 10. I couldn't speak because I was in so much pain, but I knew that there's something wrong.
Profile Centre can I help you. Good morning.
Oh, your lace is undone. Oh, dear. Thank you. Come sit by Mummy then, Billy. Come sit by Mama. Come here, sweetheart. Good boy. Well done. On Mummy's lap, please. I know, sweetheart. All right.
Is he not happy?
No. Basically, he gets Invitigo quite a lot. This time round, he woke up screaming and like going, it hurts, it hurts. But I think it's where? I think it's up his nose. He's picking his nose, putting it in his mouth, and it's transferring from here to here.
I think what we should do is do a whole lot of swabs to find out if there are viruses there. Because, of course, if there are, I mean, that would explain a number of things. That would explain why he keeps getting it. And it would also tell us a slightly different approach to treating it.
Yeah, this time he's in a lot more pain with it.
Finley, can you leave that alone, please, sweetie? What else can I find you to play with? Let's...
What's that? It's OK, look. Say thank you. There you go, don't drop it, because it's quite heavy.
Yeah! Ah, fantastic.
Good boy. Mummy, see?
I was going to say, children aren't always very good at knowing whether they've got pain or not. They describe something as pain when it isn't.
Yeah.
So, very healthy. He's doing, actually, what children should be doing, exploring. We just have to make sure he doesn't break anything.
Himself, yeah, because he will jump down from there.
Well, that's all right.
Come here, sweetheart, listen. Oh, you're going to go for a sleep, are you? No, then.
There's a...
Look, you're making a mess.
And we'll also take a swab from his nose to see if he's got stuff in his nose.
Yeah.
Because that might be relevant.
Yeah, and he doesn't stop picking it.
No.
Stop picking.
I don't... I think this is a normal child. I think he's doing all sorts of normal child things.
Are you?
Which include picking his...
Oh, and eating it. That's gross. Booger bogey pie.
Go and get the stuff. I won't be a moment.
Okay. Let me see in your ears. Ready? Finley? Mummy, have a look. He's taking your job, I'm afraid.
Very good, very good. Finley, just put your head back.
Good boy, that's it. Good boy. Tickle, tickle.
That's
it's okay, good boy.
Very
Well
good.
done. Finners.
The other one, he needs to sit on your lap.
Finley,
this will hurt a little bit, so keep very still.
Okay, it's okay.
Finished.
Well done. Well done. Good boy. High five. You did brilliantly. You did great. There.
Who's the doctor?
Dr. Cordelia. Yeah.
Hello. Just hold it for 10 seconds. So yes, when the results come back, give him a ring and see what he wants to do about it.
All right, okay.
All right. Bye-bye. Yeah, okay.
Hazel Sarrow, please. Have a seat.
Right, thank you. Okay. Oh, nice and cool in here.
The windows are open, I know. Yeah.
It's like me, I got my whole house open.
Right, what can I do for you?
I have 2 fingers that keep locking up.
OK.
Which I thought would go, but my little finger is now following that finger.
Right, so it's your little finger and your ring finger.
Yeah.
And how long has that been for?
It's been, I'd say, for about a good 5-6 weeks. But I thought, you know, like sometimes you think you've pulled something and it'll go.
Yeah. So they're locking shut.
Yeah. They're like actually down like that, and to get them to go up with the rest of them, they kind of follow along, but like within a clicking movement.
Yeah. And how painful is that then?
Doesn't hurt.
Doesn't hurt.
It's just weird.
OK.
It probably follows along with the rest of me.
So, OK, let's have a little look at your fingers. So, at rest, doing nothing, not painful? No. Looks OK.
I've not noticed any swelling
No
or...
swelling?
Yeah.
No. So there's no funny nodules or anything?
Not that I noticed.
No, good.
In my pudgy hands.
They're not pudgy. OK, I mean, it sounds like sort of trigger finger.
Oh, don't tempt me. I've got a lot of people I could shoot at.
Let's have a look. Right, so, yep, that makes a good diagnosis, isn't it? A trigger finger is a finger that becomes locked after it has been bent, flexed. That's exactly what it is, isn't it?
Yeah.
And 1 in 5 people will improve without any treatment.
There you go, then.
OK.
Yeah.
Now, if it's not bothering you, I think that's our biggest option, isn't it? Sometimes then, if it's not helping, you can use a splint, a steroid injection into the tendon sheath.
That sounds lovely.
Yeah, it doesn't, does it, really?
Yeah.
So let's do the nothing.
Yeah, I didn't expect there to be a quick and easy answer. Yeah.
There we go. This is about your fingers.
Your wonky fingers.
Yeah.
Yeah, lovely job.
Nice to see you. Bye-bye.
Bye.
Come on in, have a seat.
You right there, love, yeah?
Yep. OK, so I've got a letter from the probation service.
Well, I got released, obviously, yesterday from Guy's Marsh prison.
OK, yep.
So they would, obviously, what it was, I wanted to get things in motion. I wanted to plan things to make sure, because last time I got out of jail, I ended up getting back on it. So this time I put a few things in place to make sure everything was right. I ain't gonna lie to you, my chest is bunged up, you know, and I started smoking again, like
Right.
a bit of twat, really.
So you're allowed to smoke in jail again?
No, you're not allowed to.
As soon as you came out?
Yeah,
Right.
you know what I mean? Where I'm not used to it, it's
OK.
killing my chest off.
That's fine.
This is what I wanted to show you.
Oh, yeah. OK. So what's that from?
Burns.
From what?
From being picked on in jail.
Really?
Yeah.
With cigarette butts or?
Yeah.
Right. Oh, dear. I think they're infected.
Yeah, that's
OK?
what I thought.
So we'll try a course of antibiotic for that, OK? So that's another thing. Yep. So there's quite a few things. Take a seat again.
I need to also see something about my mental health.
Yeah.
My head seems to be going on me. 1 minute I'm all right, next minute I'm stressed out. I actually feel like suicidal.
So they said there's a few things. Should we make a list to start with?
Refer to a list because,
Come on in, hi.
I've wrote a bit of a list.
All right.
Sometimes people need more than their 5 minutes.
It's 10 minutes, isn't it?
10 minutes, whatever it is.
What else have you got on your list?
It's about 1, 2, 3, 4, 5, 6. See, my memory is very...
I know the feeling. Look at me. I've got lists everywhere.
What I will probably do today is concentrate on the acute thing, if that's OK. Otherwise, I'll be in big trouble, even bigger trouble in the waiting room.
There's 1, 2, 3, 4, 5, 6, 7 things that I'm going to try and do in 10 minutes, which is going to be quite tough, all right? So I think we get the things that we've got to get done today.
Important things, yeah.
And then we'll
that's
move
fine.
on, OK? Is the probation officer that you've got helping you
it's
with
the
things
same.
like housing and...
Yeah.
Yes.
Also asked her to try and get me out, because obviously I was doing a bit of reading in there. I was getting
Yeah.
pretty good at it as well, so I want to continue that.
OK. And at the moment, you are not taking any opiates, any
No.
heroin or
No.
substitutes. OK, so that's that form done. OK. And your certificate will have drug addiction therapy as the reason why you're not working, yes?
Yeah.
Right, and have you used at all since you've been
No, I
out?
ain't used nothing.
So I'm going to do the scripts now for 16 milligrams of the Subutex on a blue script. Yep. So in prison, you were essentially bullied. Yeah.
Pretty much.
Did and you didn't feel safe?
Nah, I felt safe, but just, you know what I mean? Yeah, I wouldn't say bullied. I wouldn't go that far.
Wouldn't you? Well, those attacks on your body.
Yeah. Childish, innit?
Yes, exactly. Yeah.
Yeah, believe it or not, there's a lot to take in when you're this side of the wall. Believe it or not.
It's very different.
Still soaking it in at the moment, yeah. It's a lot more stressful out here than it is in there.
OK, so let's do your chest next. So you've got asthma.
No, I ain't had it for years. Well, I have, but it comes and goes sort of thing.
Yeah.
Because I just got out from non-smoking
Yeah.
to getting a little bit carried away, if you know what I mean.
Do you think you'll be able to do anything about smoking?
Well, give up, you mean?
Yeah.
Oh, I don't know about that.
So let's have a listen in and check you haven't got an infection or something. That's clear at the front. You're a little bit wheezy at the back. Definitely. So you didn't have any problems whilst you were in prison?
No.
I'm just thinking that if I give you some inhalers, I'm not sure how useful they're going to be if you're smoking quite a lot. You know what I mean?
You just cut down.
Yeah.
Well aware of that.
Yeah. Do you want to just try that for the next 10 days, and then when you see Dr. Clark, you can review it again?
Yeah.
So for skin things, we normally give flucloxacillin 4 times a day for 5 days. Yeah?
Yeah, that's fine.
So that's another script for you to take round. OK, so how are we doing? So we've done the amitriptyline, we've done the Subutex, we've done the form for Rhodes, we've listened to your chest, we've done a certificate, we've done the skin. So the only thing we haven't done, which I think really needs a bit longer than we've got, is to think again about how your mood is.
Well, you want a deadline, are you?
Well, we get 10 minutes for each patient.
Oh, right.
Yeah? That's what we're booked. And it's difficult to manage this many problems in 10 minutes,
Yeah,
but
of course.
I'm giving you a bit more time and not helping the others out with the other patients
Yeah,
at the moment.
I appreciate it.
Is that
It's
all
just
right?
like, if I don't cover all the angles,
Yeah.
you know what I mean, it gets
Yes.
too much for
Yeah.
me to deal with.
So what I want to do is get you an appointment to see Dr. Clark before this script runs out, and you really must attend it,
Yeah, don't
OK?
worry, I will be.
And what I'll do is I'll give you 20 minutes with her.
Everything, yeah?
That is everything apart from reviewing your mood, which I think needs more time.
Yeah, definitely.
Yeah? OK, George.
Definitely. Appreciate that. Thank you.
That's OK.
Have a nice day.
Bye now.
Bye.
What's your date of birth?
8240. Hello, you're not here as well, eh? Oh, my door. Everybody's falling apart.
Hi.
Hiya.
How are you doing?
I've had a really funny tummy
right.
since last Monday. And really painful. And I thought, OK. And then after that, I sort of felt a bit dizzy, fevery. So I went to bed early, but the next day the diarrhea came, and that wasn't very pleasant. And that's been going on since really.
So
And,
basically it's been exactly a week now then?
every time I ate something, you know, 5-10 minutes later, I was in the loo. The worrying thing last night was I sort of woke up and just had a glass of water at about 3. Got the griping pains, but also these awful pains down my leg again.
All right. You said that things seem to have settled a little bit over the day-to-day. Is that compared with all week, or is that just compared with last night?
Compared with all week, really.
And no blood anywhere?
No, thank goodness.
Are you working at the moment?
I work in a primary school.
OK. What do you do there?
I'm a teaching assistant, but you can't rush off and go to the loo for 10 minutes
No,
in
well,
the school,
also,
can
if
you?
it is a bug, which it does sound very likely, you wouldn't want to be spreading it around the school too. So, 162.99, which is a little bit high. Sometimes, if you're a bit unwell, it can push it up, and you know, sometimes just coming to the doctor can make it high. So I'm not going to get too worried about a single high blood pressure reading when you're not very well. You said nobody else has been unwell. Have you eaten anything funny?
No, the only thing I could think of, you know those baguettes you can get, those part-baked things? I'd done those on the Sunday, but everybody had eaten a bit of that.
Okay.
But the following day I had a bit with some cheese, and my husband picked them up later, and you know how sometimes the bread bag can smell of acetone? He said to me, these... I thought, oh, no, I've eaten a bit of those. That's the only thing that was different to anybody
But as you say, everybody else had them, so it'd be unusual.
Them, you know, on the Sunday.
Hop up on the couch. Let me have a feel of your tummy.
OK.
There you go. Rest yourself back. Can I just have a look
Yes,
here?
of course. Probably a bit warm.
It's all right. How many times a day are you going when you get the diarrhea?
Sort of like every couple of hours, but I'm not wanting to eat much. So,
No.
But it's always after I've eaten something, about 20 minutes or so.
Yeah. Any pains in the legs now?
Nothing.
No.
Just the pressing pain. That you're
Sure. Well, jump up and come and have a seat. It is likely that this is just a tummy bug. Where you've got it from is sometimes difficult for us to say. And it's true that you wouldn't usually expect to get leg pains as one of the things that you get with classic tummy bugs.
That's right.
Sometimes you might get some leg pains if you've got a temperature or, an illness that can make you have aches and pains all over in the muscles. Right. Or it may be that you've just lost some of the minerals in the diarrhea and that's got you a little bit deficient in some of those that might give you some cramping. So there are a couple of explanations that I'd be happy with. But I think the main thing is, actually, they seem to have settled down and the diarrhea seems to be settling and actually your tummy is soft and there's no tenderness there now. So I'm not going to overreact. I do think you need a few more days off until it's all definitely gone away. And it's definitely true that I would like to see a poo sample because it has been going on a week, just to make sure that there's no infection there that we should be treating.
OK. So do I get that from the treatment room?
From the treatment room. Sorry, I've run out of them from here, so you'll have to go and collect
Thank you. Nice to see you.
Nice to see you, and I hope it settles down in the next few days.
And me. Thank you so much.
Bye then.
Bye-bye.
$11:30, 12 o'clock, 12:30, 1 o'clock, 1:30 or 2 o'clock. Or I got Monday evening.
Right, what do we need to discuss?
You've had pains in your ankle, haven't you, for a while?
Pains in the...
In her ankle, and then it's all swollen up. She's been down twice before because it's swollen. They gave her antibiotics, but it hasn't gone down. She'd come back again because her leg was swollen, like the top of her leg was swollen.
3 inches bigger than this.
But the last couple of days, she's suddenly been getting pains in her head, like headache pains, and saying that her face and things ache.
And now here hurts, and in the car, my jaws started hurting, and it's inside.
But she's got a hospital appointment to come for Tuesday, but I didn't want to leave it sort of the weekend.
Do you mind if you just have a look and see what the last doctor wrote about you? You had a sore wrist as well, is that right?
Yeah.
You still got a sore wrist?
Yeah, it hurts when I do that.
She wondered whether you might have what's called inflammatory arthritis, which is something that can be triggered off by infections in children. Felicity's case is not clear-cut, but she had several features such as swelling and tenderness of joints, which suggested inflammatory arthritis. There are several different types of inflammatory arthritis, and it can affect all age groups, including children, very often triggered by an infection. So the first things you saw were these spots?
Yeah.
And are they starting to improve?
Yeah.
OK, so whereabouts in your head and your jaw is it hurting at the moment?
Here and up here.
OK. Do you think her face is swollen at all, Mum?
Yeah, my mum said this morning about her face looked a bit swollen.
So is that pressed around here? Is that sore at all?
No.
Particularly over there? No? Press around here, is it sore at all?
No.
No. Cut for me. It's pretty normal. Whereabouts in your head is it uncomfortable?
Like, it hurts just like when there's any loud noises, especially when there's loud noises, it makes all over my head hurt.
OK, is it hurting at the moment, your head?
No.
No. So I can't find a specific cause for this headache, which I can put my finger on.
Yeah.
OK, what we've got is lots of little things, and I suspect they are going to add up to something, but I'm not sure what that something is yet.
Yeah, OK.
I think you're probably going to have to wait till next week when you see the kids' clinic and probably have some blood tests done and see what they make of it. OK?
Yeah, that's fine.
OK. Well, I think you've been very brave and very grown up with all this, and you'll have an exciting trip to hospital next week to see what they make of it all.
Get the day off of school, don't you?
All right. So you happy with that?
Yeah, OK, so, all right, thank you.
Okay.
All right. Bye-bye.
Thanks, bye. All right.
Yeah.
You're coming because I phoned you last night, didn't I? Yeah. That's great. Thanks for coming. And don't be alarmed. The reason you look worried.
Oh, yeah. Well, I am a little bit worried. Also, I'm not very well. Yeah.
OK. Shall I start with why I phoned you? So you had your smear taken, and because on that we had described you as having bleeding after sex, the report came back saying the smear results were absolutely fine and normal.
Oh, right, OK.
But this bleeding is going on.
That's what I want to talk about.
Okay.
Right, so I'm on my period now. It's the first period I've had for 3 months.
Okay.
Yesterday, I was in chronic pain, and when I say chronic pain, it was definitely at least a 9 out of 10.
Okay.
I couldn't speak because I was in so much pain.
Okay.
It was unbearable, just like... I'm really feeling sick with it every time as well, like I'm going to throw up. I'm getting really, really painful periods anyway.
Okay.
I'm getting pain after sex. I'm sometimes bleeding after sex.
Yeah.
So all these things are happening.
Can I just ask a couple of other questions, just to clarify in my head? Are you on any contraception of any sort? No. Okay. Are you trying to get pregnant?
No, we're not
Okay, so-
trying.
yeah.
I'm going perimenopausal for the last 2 or 3 years anyway, with hot flushes and all the rest of it, and then my periods are becoming more scant.
Yeah.
And when the pain happens, it feels like it's in my bowel. And each time it's been really severe, it's been that same sensation.
Okay.
It's completely abnormal.
Yes.
You know, I want thorough investigations done.
Agree.
Because
Yeah,
they've done these, you know, the ultrasound and everything, and I could feel it in my bowels.
Yeah.
The pain is so severe that I knew that there's something wrong.
In my drawer, you'll find a pack of, like, rice cakes.
And plenty of fruit and veg.
Always eat pears every day.
Sometimes I'll literally eat like a salad and I look like I'm pregnant.
Yeah. Because I stopped drinking cold water, and it's been more than a year now. I just drink warm water.
Made any difference? No.
And what about meat? Do you eat much meat?
On a Sunday, I have my cooked dinner, but probably in the week it might be ham.
I've practically given up cheese.
That's a shame.
I know. Every now and then I have a little binge out.
Yori McRae. So if you come round and have a seat. And your mum? Yes?
Maxine, yeah.
Maxine. So I'm Dr. Graham. How can I help?
Yori has been doing a regular checkup on his health about overweight.
Yes.
He went to see the consultant in children's.
Yes.
And I received a letter that he needs to sign up on the program for Slimming World.
Right.
Where he, I think they sent a letter about him getting some vouchers.
Yes. And he's still being seen by the clinic at the hospital?
Yes, he have an appointment coming up in November.
OK, so the plan is that he goes to Slimming World or Weight Watchers before then?
Yes.
And then they see how that goes?
Oh, yes, because he's overweight for his age.
Yeah. OK, that's great. So we need to fill in the form for the Slimming World and Weight Watchers scheme. Let me explain to Fiona how that works, OK?
OK.
So if you go into there, OK, so it's Live Well Bristol is the organisation that's running this service. So what we do is we fill in the form and you sign to say that you give permission to be run by this organisation. And then they ring you and they tell you which services are available near to where you live. This is usually for grown-ups. You are quite grown-up, so I think it's reasonable to go to a grown-up one. How do you feel about that? You're all right with that? I think that's what's important, to be honest. Is it something you want to do? Because you need to do it, don't you? You need to want to do it yourself, yeah? Do you see what I mean?
Yeah.
And you'd be going too?
Maybe.
No, accompanying him.
Yeah.
Is what I meant,
Yeah.
really. Yeah. So I will put that through.
Yeah.
But I want to tell you what the children option is.
Yeah.
Yeah. So the children's option is something called Alive and Kicking.
He has been through that several times and it doesn't...
Fine. That's helpful. I'll put that down here. This is about re-educating normal eating patterns. Are you feeling reasonably positive about it? Yeah? Good. OK.
So do I take this or I leave this
No,
with
no,
you?
we process that.
Oh, you process it and
Yeah.
OK. Thank you very much.
That's all right. OK.
Thanks a lot,
Bye now.
Dr. Graham. Bye.
I agree, it's time for us to ask gynecology to see you.
Yeah, definitely.
It is worth just checking your ovarian hormones to see where you are in relation to menopause. So if we'll arrange for a blood test, I'll request a scan, I'll write a letter to gynecology asking them to see you.
OK. So there'll be specialists in Andrew.
They'll be specialists in that, you know, gynecologists deal with everything.
With all of that.
all women's health kind of.
Okay, brilliant.
Can I put a hand on your tummy? But I don't think I need to do an internal examination in that you've had all these scans that are doing that.
So you just need to
Just want to, yeah, if I can just get you to come and lie yourself on here. And you're still feeling pretty tender.
yeah.
Yes, you look like you're kind of moving gingerly. I'll start on the right side just so. Even that's a bit sore. Yeah.
It's really tender actually.
And that is sore over there if I press a little bit harder.
Yeah, that hurts.
Yeah. Okay, fine. Come and sit yourself up again. I'm not going to do any more than that today. And you say that someone has looked at your cervix.
Yeah, they
just want to make sure that
they
that's...
put a camera inside me when they did the ultrasound as well. They did an internal.
But that's an internal scan rather than having...
I thought they were checking the cervix as well.
They don't look at it. I want someone to visually...
Okay.
Okay, so leave that with me.
Brilliant.
Just take that to the desk. They'll sort you out the blood test.
Excellent.
Okay. But if you're in trouble, just give us a ring.
Okay.
And I'll get back to you.
All right then. Thank you.
Get you back in. All right.
Bye.
Let's go. Hi.
Hiya.
Let's go. Follow the
You
doctor.
Zachary?
Yeah, he's Zachary.
Yep, come along, Zachary.
Okay, follow the doctor in. Joshua and
More
Benji's on the
chairs
floor.
for your clan,
Don't
I
worry, no,
think.
they can just sit on the floor.
Mum, come and sit here, and we'll find another chair for you, Zachary.
Zach can sit on my knee. It's fine.
Okay.
No problem. Come here, Puppet.
All right, an eye problem, obviously.
Yes,
Yeah,
really
talk me through it.
Just, I mean, he says it was hurting yesterday, but I've only noticed it today. And he just can't open it, and he's rubbing it, and I've tried to have a look, and I can't see anything in it, but I just wanted to... He's really crying in pain. At times, it seems kind of on and off.
Did it come on gradually or suddenly?
Suddenly, I think. Did it come on suddenly? But it's just the opening. He's still doing this all afternoon.
Yeah, okay. Can he see through that eye? Obviously, it's uncomfortable for him, but if he opens it...
At times, he's been okay.
Yeah.
And he's... Yeah, you can see through it, can't you? It's difficult to tell whether anything's blurry or anything.
Okay.
So, sorry, that's not very helpful.
Okay. And has he had any discharge from it?
No, nothing at all. It looks very bloodshot, but...
It does look very bloodshot.
I think that might just be the rubbing.
Do you think he's managed to rub anything into it?
Well, I mean, not that... I mean, it's not like he's been playing in the mud today or anything.
Okay, look to your right, would you? Okay, now we're going to look in this one. It's interesting, Mum. If you look in this side, even this one's a bit
I know,
bloodshot.
he's not been rubbing that one at all.
No.
That one's been the good one.
All right, now I just want to check that you can see all right. Okay? You're going to have to open your eyes for this. How's your reading, Zach? Are you good at reading?
He's very good at reading.
Yeah? So if I give you something to read, you don't really need to manage the words, you just need to tell me what the letters are. Okay? Let's cover that eye, and you can just tell me what the letters are at the top. All the words, if you want. A P, then what?
Le.
Fantastic. And now let's try it with this eye. Open it up. Fantastic. So your reading's all right. My guess is he's actually got a viral conjunctivitis. That's what it looks like. So quite watery, uncomfortable, red both sides. Bit worse on the right, and he's compounded it by rubbing, and maybe he's scratched the surface or something like that. And I suggest what we do is give some soothing drops overnight. Okay. These are technically antibiotic drops. The point of using them is that if he has scratched the surface, then they will just help it to heal.
Okay, great, thank you very much.
All right.
Okay, we're going to get some nice drops in.
You were terribly good today, actually. Fantastic.
You were really
good work.
brave. Good job. A little bit of medicine in your eye is going to help it feel better. Okay?
Okay, well done. Well done.
Okay, are you okay? If you walk, I'm going to take that prescription. Thank you very much.
Do try not to rub them, okay? Because when you rub a bad eye, it sometimes makes it worse.
So viral conjunctivitis isn't going to be infectious, is it? Or is it?
Be.
Everything else. We'll wash hands, okay. Great.
I'm going to wash mine anyway.
Okay, good. Yeah. Okay, out the door, say thank you very much. And
well
bye-bye.
done, guys. Bye-bye. Bye-bye.
Thank you.
Okay,
Thanks a lot.
bye-bye.
Which way do we go?
You go left.
Oh, left. Perfect. Right.
It came in from my stomach because I did another poo sample last week.
I saw that.
Yeah.
Yes.
And that's come back the same.
Yes.
I'm still getting the same problems. I'm doing the FOD diet now.
Okay.
And
how's that?
It's going okay. So I'm trying to stick to it as best I can. I'm still getting the very loose diarrhea in the mornings and the cramp. It's when I'm in the toilet and I'm having this, like, I go so hot and clammy and sweaty.
Right.
Like, I need to have the door open.
And how often does this happen?
It's every morning. It's in the morning as well, it happens.
Is it always once a day, or is it more often?
Well, I only do it once a day.
It's once a day?
Yeah.
It's once a day, and then...
I have very bad bottom wind all day.
Oh dear, right.
Constantly, and it's quite, I mean, it can be quite embarrassing because it is quite bad.
Yeah. And when did you start this FODMAP diet?
About a month ago now.
And are you managing to stick to it? Because I know it's not that easy, is it?
No, I am. Apart from pork pies, I kind of got a thing for pork pies. I'm trying to cut back on them.
Okay.
So, because I think they're probably... And also, Coke, cans of Coke, I've cut down a lot on that because I know that's not good either.
That's not good, no.
No,
really and... And how much Coke do you have a day?
Probably about 1 to 2 cans now.
And what were you having?
Probably about 4 or 5 cans. So yeah, it's not.
Is that Diet Coke or is that ordinary?
Ordinary.
Ordinary Coke.
Yeah. So,
okay.
Which I know is.
I think that's probably quite a lot of the problem.
Yeah.
Isn't it? Yeah, because I mean, fizzy drinks are really bad.
Really bad.
Really bad for you, and all that sugar content as well.
Yeah.
Let me just look at the tests for your bowels. Okay, and we've done all the blood tests, haven't we, to rule out anything serious?
Yeah.
And celiac screen and everything. You know, we have investigated this one, and I think, you know, almost certainly this is diet related.
Yeah.
I think it's really the pork pies and the Coke, isn't it?
Yeah.
I know, it's not easy when you really like them, is it?
No, but it's, you know, it's going to help my stomach.
I think so. I think so. I think if you can do that, it will gradually get better.
Yeah, definitely, yeah.
Okay.
All right.
All right.
Thank you.
Okay, bye.
Okay, bye.
Take a seat, Craig. So thanks for coming in. So I just wanted to check your height and weight and see how you're getting on with your tablets. So how are you getting on?
They're getting on all right, to be fair.
Mm-hmm.
They're improving with the sleep.
Mm-hmm.
Because I think it's getting easier for me to cope with them.
OK. What do you mean easier to cope with them? What was
Because I know roughly when they're going to wear out if I take it at a certain time.
Uh-huh.
So I take it now as soon as I wake up.
OK.
And then it wears out usually around about when I go to bed.
OK. So, and do you feel a lot calmer on them?
Most days, yeah.
OK. Craig is taking methylphenidate, which is one of the treatment options for ADHD, or attention deficit hyperactivity disorder. Another name that methylphenidate is commonly known by is Ritalin. Craig was diagnosed with ADHD in early childhood, and initial therapy is started by a specialist in this area. And we have a shared care program by which we also monitor the methylphenidate. We have to monitor growth in children, and that's why I was checking his height and weight. It can also lead to an increase in blood pressure, which is why we keep an eye on blood pressure. You last had some kind of seizure, or that was about a year ago, and you went to A&E. You'd never had one before.
No.
What was that all about?
I was outside in my garden playing with my little brother, and he went in for 5 minutes to get a drink and go to the toilet. And I was leaning on my goalpost, and I said to my dad that I feel dizzy. And the last thing I remember him saying to me was, sit down. And he described it to me as that I literally just collapsed.
And you've not had any problems since that? So for
No.
a year, you haven't had any of this query seizure, we should call it, really?
But I have been getting dizziness since then.
Has that been long-term since then?
Happened about 3 times a week since it happened.
Not particularly itchy.
No, unless like I go, is it itchy? And then I sort of have the notion in my head.
Let's have a quick look.
These kind of bits are itchy.
Does it feel itchy?
Yeah.
Are they itchy? Making them itch with your eyes.
Oh, God, they're a bit itchy.
OK, how can I help?
I had some bloods done last Friday.
OK.
Just because I've had some symptoms of a urine infection.
There was some mention of an infection around the feeding tube. Is that the other thing?
Yep. The other day it got pulled by accident and it's just been a bit weepy and...
Let's have a quick look. What's the best way of looking?
Lift the dress up, I guess.
Yeah. Is that all right?
Yeah, no, that's fine. Yeah.
Okay, great.
It's not taped the best, but yeah, it just got a bit yanked the other day. I've been cleaning it.
Natalie has a feeding tube because her stomach doesn't empty properly. So she has a tube put in beyond her stomach in the small bowel.
A bit weepy, and it's a little bit red.
Yeah.
A bit inflamed. Yeah.
Yeah, and it's not usually like that.
So, and the fusidic acid normally does the trick, does it?
Yeah, it usually does.
I think because it's weepy, it's worth giving you some of that, OK? And then if it's only inflamed, sometimes we just give some steroid cream for it. So hopefully that will clear it up.
Sorry, thank you for...
That's that.
doing all that. I always feel awful.
That's all right. Let's go to the blood test. So the kidney function is entirely normal.
Wonderful.
The liver function is pretty much normal. So your ALT, which is one of your liver enzymes, is slightly raised, but actually less raised than it has been.
Yeah.
And then you thought you might have a urine infection?
I thought I might do. I dipped it at home because I've got the dipsticks, and it came up with negative anything at the time, just because I've had urosepsis a lot.
Yeah.
Just overly cautious, and yeah, I've had to self-catheterise a few times on and off.
If you had nothing in the dip and your bloods have been all right, you probably haven't got an infection.
Natalie has a history of regular urine infections, which are a common complication when people self-catheterise, and sometimes those infections can be quite serious and not only in the bladder and can cause her to have bacteria in her blood, which is a much more serious condition.
There's quite a lot of evidence that quite a lot of people with symptoms that suggest a urine infection will get better without any treatment, and quite a lot of urine infections are inflammation rather than infection.
I'm constantly inflamed everywhere at the moment, so I did wonder if it could just be...
part of that. Yeah, OK.
Is there anything that I can do to help when I'm having the allergic reactions? I'm taking IM Piriton, cetirizine down my tube, prednisolone. I've got steroid creams, but I just can't stop scratching.
You're on quite a lot for it.
Things, yeah.
Already. So I'm not sure that I've got any miraculous ideas. Sorry.
Smothering myself in Dermacol every night.
She stops you from scratching.
She does, yeah.
The reason why you want to scratch is because histamine's been released. But when you scratch, you release more histamine.
Yeah.
So trying to not do it, but it's kind of easier said than done, isn't it?
Yeah.
Okay.
Yeah.
All right.
Thank you very much. Thank you so much for your help.
That's all right.
I feel like I need to breathe in.
OK.
Thank you very much. Nice to meet you too. Thank you.
We should see you every year while you're on these tablets because we've got to keep an eye on blood pressure and height and weight. It may be worth you just booking in for a routine blood test. Just want to check a few things out with regards to the tablet, and also because you mentioned feeling giddy 3 times a week. And does that have any effect on you? How long does it last when that happens?
It's usually about a minute to about a minute and a half.
And what's happening? Is the room spinning?
I just can't see nothing and I just wobbles.
OK. Do you get a headache with that?
Yeah.
OK. Is there any migraines in your family?
No, but I have had migraines in the past before my seizure.
OK. So we'll keep an eye on that and get your blood tests done. If that gets any worse or changes, to let me know.
All right, yeah.
OK.
All right.
All right, Craig.
Thank you.
Take care.
Bye.
Brian Tunnicliffe. Come and have a seat.
Thanks.
Okay, so are we talking about your ear today?
Yeah, my left ear, I've either got an ear infection or a burst eardrum.
I normally suffer with them quite a lot because my hearing obviously ain't too good.
OK. What symptoms have you noticed?
Well, gunk coming out my ear, and plus I've got a bit of a cold, so painful in my ears.
It's been painful as well, has it?
Yeah.
Yeah. Is it painful now that there's stuff coming out of it, or was it painful
Not
before?
as much.
Not as much, OK. So was it painful and then started to discharge?
Yeah.
Yeah, OK, fine. And so have you burst an eardrum before from the sound of it?
Yeah, I've had 3 burst eardrums in 2 weeks before.
Right,
So,
OK, gosh,
yeah.
so it's happened many times.
Yeah.
Yeah. I can see, I've just had a quick look at your notes before you came, and I was seeing that you've got hearing aids and so forth. And is your hearing not so good at the moment as well?
Not so good at the minute
Yeah.
because obviously, yeah. Plus I've just come back from Benidorm, which the heat might have something to do with it as well.
Were you swimming?
Yeah, quite a lot.
OK, OK. So let's have a look. Just get myself a...
I'm going to have to take out my hearing aid now, but yeah.
So once you've taken it out, can you hear me?
Yeah, because I still can hear in my right ear. I'm just deafer in my left ear.
Fine.
But you might need to speak up just a tiny notch.
I will.
Thanks.
Let's just... Oh, I can see the muck without even putting my thing in your ear here. I will have a little look, but I'm sure you have... Yeah, you know what's happened.
Yeah.
OK. I can't actually spot the spot where it's coming from. And there's not a lot of stuff in the canal, which is good, but I will give you antibiotics. That's what you need now.
Thank you.
OK. I don't think they'll give you your medication unless you've got someone over...
No, my mum will probably go and collect it, so yeah.
OK, so that's the week's worth of amoxicillin, same as last time, so it's 10 mils 3 times a day.
OK,
All right.
thank you. Thanks for your help.
OK, pleasure. Bye-bye.
Bye-bye.
Bye.
Bye. Bye.
Thank you.
OK, then.
Thank you very much. Yes, you'll be better off driving.
OK, bye-bye, boys. Say bye.